Our program will start shortly. Please make your way to the plenary.
For us to be truly healthy, our physical health must also match emotional and mental well-being. These states of being are connected, deeply and inextricably so. If we do not design an inclusive, crisis-proof global health system fit for the future, one that is preventative and protective of all rather than some, if we do not transform the way communities access healthcare and avert and mitigate outbreaks of disease, and if we do not look beyond the physical and look after that part of each of us which is simultaneously far stronger and more vulnerable than any measure of flesh or bone. Health and happiness are fundamental drivers of human development. They are under threat, and we must respond.
Assalamu alaikum, Your Excellencies, dignitaries, ladies and gentlemen, friends of Dubai Chambers. It's wonderful to have you all here, and I'm very happy to be with you. A big, very warm welcome to the Health and Wellness Business Forum. I'm Atna Trainer. I'm going to be your MC for the day. And indeed, we have a very, very busy day. It's Health Theme Week here at Expo, and probably one of the most important weeks, one of the big key sectors that we all need to focus on. And I think we've all been reminded of that time and time again in the last year. So it's great that all of you are here. We have a very, very busy schedule today. We're going to be talking about partnerships. We're also going to be looking at building a new workplace culture, health and medical tourism, digital transformation. And we also have some very, very interesting case studies that we're going to share with you. And we will do those throughout the day as well. So it'll be of great interest to you. We have, as I say, lots to get through. But it is indeed my pleasure to welcome to this forum today. I want you to give a very, very warm welcome to the President and the CEO of Dubai Chambers. He joins us now. So please welcome His Excellency Hamad Bouamen.
Thank you, Anthony. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Your Excellencies, distinguished guests, ladies and gentlemen, good morning. And very warm welcome to the Health and Wellness Business Forum. If something we learned during the past couple of years is the fact that health and wellness are top priorities for governments around the world. And everybody put education, business, work, and traveling in hold just because of how important health and wellness are. And this is why Expo is dedicating this whole week for this important subject. And today it's the business forum where we'll talk about how can we take this subject and look at it from the perspective of businesses. So this forum will start a meaningful conversation about the most fundamental issues impacting our business and overall well-being and survival. And access to healthcare, as we all know, it's a necessity nowadays. and all members of societies require it, and it defines the well-being of a full nations. As we all in agreement with is the fact that the pandemic is not over, and as we continue to navigate it through COVID-19 and the new challenges that's created by this pandemic, we are focusing more and more on the physical and our mental health and wellness. UAE has emerged as a leading example of a country that responded quite well and efficiently to the outbreak by implementing strict health and safety measures, which remains to be in place until now. And this approach enabled the country to responsibly reopen its borders and economy. And today, UAE is considered one of the world's highest vaccination, with the world's highest vaccination rates that boosted the confidence in the investors. We were able to attract a lot of businesses and tourists worldwide. In fact, if we look in 2021, this was the highest business activities we had during maybe the past 15 years. So definitely all the measures that were taken by the country paid up its dividends to businesses. As you all will hear more today, the business environment in UAE and in Dubai has proven itself to be one of the most advanced globally, making it attractive for global investors in healthcare sectors. And our leadership forward vision keeps attracting cutting-edge technology and human talents in the medical field for the past many years. And over the years, the sector has undergone significant transformation as more private sectors players and investments enter the markets, while the governments continue to facilitate and play a role in adoption of advanced technologies and putting the right regulations in place to support these important sectors. Meanwhile, Dubai is strengthening its position as a leading medical tourism destination and investing in building new segments within the market, such as the health tech, which has been rapid growth following the COVID-led digital shifts. According to the International Healthcare Research Center, Dubai ranked 6th in the world, that's in the Global Medical Tourism Recent Index of 2021. And we see the expansion of the medical tourism to contribute to the development of healthcare facilities, while in the same time it benefits the rest of the economy and other sectors, including the supply chain of logistics, the financial sectors, trade, and tourism. So definitely this sector is very, very valuable for the rest of the economy. Distinguished guests, if something this pandemic has taught us is the fact that the growing importance of investing in a world-class infrastructure when it gets to health and wellness, and in advanced technologies that can improve the healthcare experience and make our societies safer and more prepared for any future crisis. Improving the well-being of all individuals in United Arab Emirates and in Dubai is the underlying driving force for our far-reaching healthcare strategy that will place the country and the city of Dubai as a global model for health and create attractive business opportunities for investors. For its part, Dubai Chamber of Commerce facilitates cooperation between UAE healthcare companies and their international counterparts and promote Dubai as attractive healthcare markets in the global arena. The success of Expo 2020 Dubai as the first World Expo in this part of the world and the main mega events held during COVID-19 sent a strong message that our country and our city is open for business and open to gathering people and can bring nations together to share knowledge and innovation solutions that address global challenges. And I'm aware that this will be one of the sessions that we'll discuss more details about later on today. The Chamber has been working very closely during the past number of months during Expo time with the private sectors through various platforms to identify opportunities for investments and innovations and connect businesses regionally and globally. The business community has a huge role to play if we need an effective way to deal with health issues and spur innovations and growth in this very important sectors. I hope that today's discussion will allow us to re-examine these issues and identify areas that will define the future of healthcare sectors globally. With this, I would like to thank you all for participating in this event, and I wish you a very successful and productive event. Thank you.
Your Excellency, Hamid Bouaman, thank you so much for that introductory and that welcome talk there, really laying out the great opportunities that exist in the healthcare sector, as they do in so many areas here, of course, in Dubai, and the great work that Dubai Chambers is doing to make sure that we're bringing a community together and helping everybody to spot those opportunities and to do good business here. As you say, we're open for business. There's so many opportunities here, and it is a dynamic time in the industry and a very, very important time, and an important time that everybody really looks at what's happening here on our doorstep. And again, I think making sure that there's the efficiency and the strengthening of the supply chain, particularly, I think, when it comes to the health sector. It's something I think we're now more aware of than possibly ever before. So once again, thank you, Your Excellency, and as always, great to have you all here, and all of our friends from Dubai Chambers. Thank you so much for facilitating this and having this very important and urgent discussion. Now we're going to begin with our first panel, and we're really looking at partnerships for achieving global equity in healthcare systems. We can't do this alone. No economy can do it alone, no sector can do it alone, no hospital can do it alone, no health authority can do it alone. It really does take combined effort, and there's so much, again, as His Excellency mentioned, knowledge sharing, all of the great work that we can learn from each other. And I think this is what's so important. So our moderator for this session, I want to welcome him now to the stage. He is the Head of Healthcare Strategy Consulting for JLL MENA here in the UAE. So a very warm welcome now for Sandeep Sinha. Sandeep.
Morning, everyone. I think for the panel which we are talking today is the partnership for achieving the global equity in healthcare systems. I think this is very, very pertinent topic, in the current arena of pre to post COVID and then recovering from the COVID. And this topic, I think, is becoming a more required for within the nation and between the nation and at a global level. And to run this panel very successfully, I have an eminent panel today to join us from a couple of them from the virtual meeting. And then I have here with me Dr. Carlos, who is joining us in person. Dr. Carlos is the Professor of Material Science, Technological University of Havana, Cuba. He has come all the way. Dr. Carlos, please, welcome.
It's an honor for me to be here with you in the amazing country, a wonderful country. Okay.
Thank you, Doctor. Thank you.
Now,
to introduce the other panelists, we have Dr. Sangeeta Reddy, who has joined us from India. She's the Joint Managing Director for Apollo Hospitals Group from India. And Dr. Sangeeta, thank you very much for taking us time
for this session. It's an honor for me to be here.
And we have
pleasure to be here, thank you.
amazing country, a wonderful country. Okay.
Thank you, Doctor. Thank you. And then
Thank
I
you.
have
Thank
with me Dr. Ajad to introduce the other
Who's that?
panelists. We have Dr. Sangeeta Reddy, who has joined us from India. She's the Joint Managing Director for Apollo Hospitals Group from India. And Dr. Sangeeta, thank you very much for taking us time
It's an
for
honor
this
for
session.
me to be here.
And we have
Pleasure to be here. Thank you.
Amazing country, a wonderful country. Okay.
Thank you, Doctor. I have with me Dr. Ajad Mupen, who is the Chairman and Managing Director for Esther Group, Esther DM Healthcare Group. Thank you, Dr. Ajad. Thank you for joining us.
Thank you. Thank you very much, Mr. Sinha, for this opportunity. And I really appreciate and also appreciate His Excellency Bohim for giving me this opportunity to address all of you. Thank you.
Thank you, Dr. Ajad. Now, I'll straightway go to the panel. As we all know, the topic of the panel is Partnership for Achieving Global Equity in Healthcare System. And one of the most, key question, which I'm sure which must be coming from all of us mind is, why this subject is so important? And are we really aligned? So I would request Dr. Sangeeta, if you can throw some of your views why the global equity in healthcare ecosystem is so important post-COVID. I know this was important even the earlier, but why do you so? Dr. Sangeeta, please.
Good morning, and thank you once again. It is indeed a great pleasure and a privilege to be amongst you. And let me begin by congratulating UAE and the Dubai government, not only for the outstanding Expo and for coordinating this session, but for thought leadership and vision across the decades to build and evolve your country into the tremendous role model that it is today. And it is a role model not just in infrastructure, capability, and quality of life for people who come in, but it is a thought leader. And when I heard earlier today the very profound words that health and happiness are among the foremost factors for human development, you reiterated once again how the thought process is really driving development. So I'm especially happy to be amongst you today to share some thoughts on health equity. And health equity is indeed a complex subject and requires a multi-sectorial approach. And hence having business chambers come together with governments and experts to say, let's talk about something so important. The pandemic brought to the fore like never before the fact that we are one world. We are a global village. We are connected. We are interconnected in a multitude of ways. And therefore, none of us are safe until the whole world is safe, not just in the aspect of vaccine, but across the entire spectrum of healthcare. And before we really jump into things that we can do, I think it's important to highlight the vast differences that exist. In low-income countries, the average life expectancy is an average of 62 years, while in high-income countries, it is 81 years, a 20-year difference, almost a whole generation. So a child born in Sierra Leone can expect to live for 50 years, and someone born in Japan can expect to live to 84. This itself starkly highlights the difference in healthcare and the outcomes of an unequal healthcare system. Children less than 5 years of age are 15 times more likely to die in sub-Saharan Africa than in the rest of the world due to pneumonia, malaria, diarrhea, and other disease, all for which we have a cure. In developing countries, they account for 99% of the annual maternal deaths. So a woman in Chad has a lifetime risk of maternal death. Her risk is 1 in 16, whereas a woman in Sweden, her risk is 1 in 10,000. So I can keep on giving you statistics like this, but I just suffice to say that this is a significant problem, and I once again commend you for focusing on this. And coming to the more recent environment, vaccine inequity. Africa, being 18% of the world's population, has received less than 4% of the world's vaccination. And so, can we ever see the end of this virus till we know that the whole world is vaccinated? And this indeed really highlights the ongoing problem.
apart from ongoing challenges like unemployment, like poverty, like inequitable disease burden, health is one of the biggest factors. I just wanted to make these opening remarks, and then later we can discuss how. But I believe that the pillars which enable a global health equity include partnerships across the board, whether it's in building hospitals, managing hospitals, sharing science and research, using technology, innovating, tech adoption and enablement, and finally and most significantly, manpower and human resource with capacity building. I think it is estimated that the global shortage of healthcare workforce is going to be almost 18 million. So the ability to seriously plan and partner for this. But most importantly, I think it needs a vision and policy enablement across the globe. So
Thank you, Dr.
Congratulations for this.
Thank you, Dr. Sangeeta. I think you have definitely raised a very important aspect of multi-sectoral approach. Health cannot be dealt in isolation. I think this is a very, very important view which you have given, and you have also mentioned about the various aspects on the different stats, right from the China or from Japan to the sub-Saharan countries. I think this definitely brings a very important topic, that there is a more requirement of the alignment within the countries, within the continent, within the nation. I think this is something very, very important. And then we have Dr. Azad, who actually manages a large enterprise at multiple countries, right from India to the GCC and other Middle East countries. And I would like to hear, Dr. Azad, your views about what are the key points, or are we really aligned, or are we ready to work towards the equity, global equity in healthcare systems? Or we should rather just focus within the country first, or then go to the global level. If you can just throw your views, because you have a very vast experience of managing the multi-country healthcare systems.
Sure. Thank you very much once again, and I again appreciate the visionary rulers of this great country, and also the ministers and the officials who have done a fantastic work, like what Dr. Sangeeta Reddy said. We all feel proud to be in this country, which has got excellent healthcare infrastructure and delivery, as well as during the COVID, we managed it in the best possible way, and we are at the top when it comes to the vaccination drives. So that is one part of that. We are living in a country which is in an affluent group like the Western countries. But when you look at the other countries, like what has been mentioned already, what is that we could do is a big, big question mark. So this is true about UAE, but when you go to other countries, like for example, even India, a large number of people, even though it is a country which has got huge resources in healthcare, large number of people who are not having access to quality healthcare. Let alone countries in Africa, where again, there is a huge issue of not having funding as well as infrastructure. So when you go from country to country, depending on its financial capabilities and the population, there is huge gap between what is a good, excellent healthcare and what is present in each country. The PQL index, which is the physical quality of life index, which consists of various things like the life expectancy, which has been mentioned, child mortality rate, maternal mortality rate. It's so low in most of the developing countries, in the range of 30 to 40, whereas in the developed countries, which we also include UAE and countries in the GCC, maybe around 80 to 90, which is comparable to the Western countries. So what is that is to be done? What is the way in which we address that? We know that every year, 100 million people are pushed into poverty because of the lack of access to healthcare and out-of-pocket expenditure. So this is happening, and people are becoming poorer and poorer. And there is a requirement for us to look at it in a way in which the governments, of course, and along with that, the private sector also comes into the picture. So what I feel is that there has to be a partnership in which we come in and where we go into a funding of healthcare in different countries. It has to, of course, happen at the country level. The primary responsibility is for the country. But along with that, many countries which doesn't have access to healthcare require also significant amount of funding. So health has to be made into a right. It has to be a right of a global citizen, rather than this being as per the situations in each country. So now we are happy that there are things like the corporates are looking at ESG, which involves also healthcare. And that is one area where a lot of funding is coming to that area. Basically, the rich should fund the poor countries to bring their healthcare up. This has to be taken up as important as the environmental pollution, sustainability and all. That's the only way in which we can do that. Because there is a huge lack of everything, infrastructure, people like what Dr. Sangeeta said, training of people, medicines, vaccines, everything there is a requirement. And if there is funding, I'm sure that this will go up. And I'm sure that one of the things, most important things which I think will bridge this gap as we go forward will be the digital. We have seen that happening in mobile phones. We never thought that most people in the country, like India, for example, having a 1.3 billion population, majority of people have got a mobile phone, even in the villages, but healthcare hasn't reached them. How can we take healthcare to them? I feel that it is only possible through technology. How can we make it happen in the hands of the people through the mobile phones? See, as we speak, we know that the situation is that for even a consultation, even though other areas like banking, retail and all have leapfrogged, in healthcare still somebody has to go to a clinic, see a doctor, and then also along with that, he has to go to a lab and to a pharmacy to get the medicines. That is what's happening now worldwide, even in advanced countries to some extent. How can we make it digital so that sitting at home with the mobile phone, somebody can be connected with somebody in the country or outside the country where he can get a consultation. And then, of course, we have to see how he gets the medicines and the treatment. Yep. So that's the only way in which we can fast track this and leapfrog this is what I feel. Yeah. Thank you.
Thank you, Dr. Azad. And I think you have definitely mentioned some of the very important aspect is the funding of the health systems in those countries which need to be upgraded when it comes to the healthcare infrastructure. And I think the funding, like how we are talking about the environmental, social, and other ESG related issues, I think healthcare also should be aligned with the similar objective. And I see that a lot of private equity investments or the large funding organizations are gradually moving towards the ESG aspect. And similarly, I think the development also will need to be taken place in the healthcare infrastructure development aspect. And while you have also mentioned the equitable distribution, the funding, we can also talk about the micro health insurance, the vaccine development, and the cost-effective treatment. At the end of the day, how do you ensure that you are able to provide affordable healthcare to the masses, right? And innovation definitely takes one of the major backbone for providing these services, right? As you mentioned about the digital side of it. Similarly, when we talk about the healthcare, access. So one is obviously the funding, then the care delivery. So which is basically the nursing, the clinical team, and also the consumers and the technology side of it. So we have Dr. Carlos, who actually, and his team has, developed some 5 to 6 prototypes, which basically can reduce the major disease burdens for some of the large, major healthcare disease conditions in the cardiology or mycoplasma or other, related, disease condition, which can be kind of over a period of time get a licensed and then commercialized for a large usage. And I would request Dr. Carlos to give a brief about these technologies and the techniques which he and his team has developed, which can be definitely one of the key area. I know there are a lot of innovations happening, but this is something which I really feel that we should definitely hear. Dr. Carlos, please.
Our project, the title of our project is the development of technologies for the manufacture of health products. These projects are based on the knowledge acquired in research, which can become technologies for the manufacture of health products with the increase in life expectancy and quality of people. The topic number 1 consists in the development of technology for the manufacture of stent used in the replacement of the aortic artery valve through the procedure known as TAVI. TAVI is transcatheter aortic valve implantation. The transcatheter aortic valve implant allows the treatment of the aortic stenosis without the need for open heart surgery. Let me see. Wait a minute.
Now, again, what he was referring is basically the technology which his team has developed.
The main idea is to propose a different design, reducing the manufacturing cost. This permits the access of the people to this procedure, reducing the manufacturing cost. The second topic consists in the development of a scaffold manufacturing technology for the regeneration of infarcted myocardium through the use of stem cells. This is the prototype, no? Into the stem cells introduced into the scaffold previously, no? To the regenerate the myocardium, infarcted myocardium. The topic number 3 consists in the development of a scaffold to regenerate the aortic artery affected by abdominal aneurysm. A novelty in the development of this scaffold consists in the use of bioresources obtained from the food industry waste, the residual product, such as the legs and comb of bird, part of the animal. The topic number 4 consists in the development of technology for the coating of prostheses with hydroxyapatite by atmospheric thermal plasma projection to improve the osseointegration process between prosthesis and bone. The last topic consists in the development of the electrospinning process for the regeneration of hard and soft tissues. The electrospinning technique has a very diverse field of application within tissue engineering applied to regenerative medicine. This is our project of our organization.
Thank you, Dr. Carlos. I think I'll just try to summarize basically the areas where their team has focused in last many years in the development, and then they have already reached to a prototype stages. Primarily, one is the aortic artery valve, which basically is done through the TAVI process, which is very, very expensive. Now they have developed a prototype which can reduce the cost drastically. Then second one is in the regeneration of the myocardial infracted, because whenever there is a heart condition develops, so there is a heart muscles get infracted. So now they are talking about the regeneration of those heart muscles through the stem cell treatment. That's another prototype they have developed. Then the development of the scaffold to regenerate the aorta artery affected by abdominal, another disease condition. And again, the product which they have developed is a bio resource obtained from birds. So that's another technology which they have developed. And the fourth product which he talked about, the coating of the processes. So basically, whenever you have the implants in the body, so how the implant gets mostly absorbed with the body. So then there is a coating called hydroxyapatite by atmosphere thermoplasma. So basically to improve the osseointegration. So I'm sorry about it, osseointegration, right?
Okay.
Yeah, so that's basically being used. And then the last one is the development of the electrospinning process for the regeneration of hard and soft tissue. So these are the very, very critical disease condition which happens in a lot of heart-related condition, the implants, or even in the normal disease conditions which can develop. So Dr. Carlos and team has developed, and we definitely see there's these, not only for these products, but apart from the many such products, will have a huge integration requirement when we talk about the global equity for the healthcare ecosystem. Now, I would like to go back to Dr. Sangeeta. If you can give us your view when we are talking about the, these are the these are the key issues which we need to address. Madam, if you can just throw some of the light, like how the recent development within your organizational capacity, you have seen the integration or the extension of your healthcare services beyond the country. And then what are the key pillars if we have to really look at development of such healthcare system, which basically goes beyond the borders?
So thank you very much. I think from the time we began about 40 years ago, our chairman very clearly said that our mission was to bring healthcare of world-class standards within the reach of everyone. So our healthcare services or our vision was not just for India, but as much as we can to serve as many people from across the world. Today, people from about 120 countries have visited Apollo hospitals for our treatment. We do advanced multi-speciality treatment across cardiac, oncology, neurosciences, in fact, every major super specialty. But I will come back to some specific things which I think that we could do together. And I think that is really what health equity is all about. It's about partnership. It's about complex public issues and understanding what is the requirement of a particular country and applying solutions from other parts of the world. I was fascinated to hear a lot of the research that Dr. Carlos was talking about. And of course, we must find ways to pick up appropriate research and bring it in a effective manner into other parts of the world. And I look forward to this. I feel that India has managed to telescope the developments of the Western world. When Apollo first began, we had a very high gap between the success rates or the mortality rates in our country versus the Western world. Today, I can confidently say that we're on par with the best. This is because you can absorb technology, adapt it to suit your conditions. And this is, I think, healthcare partnerships which create this kind of a learning environment. And that is why we have helped, teach, train, bring in people, while we also invite international and global specialists. So one of the biggest areas I would first propose is that we look at a large global multi-country, multi-issue-based research to understand the problems and therefore effectively evolve what we need to do to rectify inequalities. So we collect health data, we predict, we plan for surge resourcing. When UK needed healthcare manpower, at that time India had extra. When India needed it, somewhere else in the world there was manpower. So WHO to play this role or other enlightened countries to come together is another thought. I also think that we should think of sharing high-end technology. For example, in Apollo Chennai, we have the Proton, which is the first proton machine in Asia. So this is open for people from all over the world. I was very happy to hear Dr. Moopen talk about the omni-channel healthcare experience, which should be very similar to what you do in banking or any other sector. I'm happy to say that Apollo 24/7, you can do a teleconsult on your phone. You can order your medicines. It will be there in under 1 hour. You can call for a phlebotomist. He will come home, collect your blood sample, and within 24 hours, you will have that blood report. All this will be collated on your personal health record, which can then be used to talk to your other doctor. So multiple things are happening in the evolution of healthcare. So sharing these experiences with others so that the development cycle from thought process to actually impacting a customer can be reduced. And in this, I think there's work we've done with Microsoft on risk prediction of health analysis and cardiac risk scores using a population of almost 800,000 patients. We also have lessons in combating non-communicable disease. I think India can help to become a pharmacy for the world and therefore help create more cost-effective, accessible drugs. We also can train over 1 million healthcare workers and help to use them. They can travel globally or they can do remote care. I visualize a young India taking care of a graying world. And also strongly believe that technology is a big factor. We're now doing an experiment on 5G rollout with the use in ambulance so that care begins even before you reach the hospital. So tele-ICU, e-ICUs, telepathology, teleradiology, all these are going to be transformational on the backbone of telemedicine, which can bring super specialty, latest care within the reach of everyone, whether it's a small village in India or Africa, or even a remote rural area in the United States. This is going to be the healthcare of the future. Let us together find a way to do that.
Thank you.
Finally, and most importantly, is the human resources. I've run out of time, but I'm very happy to share at any point of time with everyone, with anyone who's interested, how we can continue to partner. But I strongly believe that we must seek global equity in healthcare, and I congratulate you all for making this the topic of deliberation at your opening session. Thank you.
Thank you. Thank you, Dr. Sangeeta. And I think I completely agree. You know, if we see the technological innovation and the integration, how it has evolved in the other industries, like you mentioned about the digital side of it, Dr. Mohammed mentioned about the, Dr. Azad mentioned about the banking sector. The way it has evolved, the way it has transformed, even the logistics, the way it has evolved. And if you know, today when I travel to different countries, I don't need to have anything worried about it. You know, I need to just have my Uber account or Careem account and I manage it. Now, can we have a similar application? Can we have a similar equity in the healthcare system? I think this is something which is one of the key issue which I think we all need to, you know, evolve and work towards it. I will quickly come to Dr. Azad. You guys have been able to have a lot of exchange on the human resource between the UAE and India, shared your knowledge. What are your learnings and what are the key pillars which you think should be addressed and should be as a country or as a healthcare system we should work towards? Dr. Azad, please.
Yeah. So we have staff from 68 countries, nationalities, and we have large number of healthcare workers who are coming from India, from Philippines, and from Africa and all. So we have clear advantage of that sitting in Dubai. So that has been a major advantage, and which we are now trying to creating. We have a medical college, we have nursing college, we have pharmacy colleges, we have large number of people who are under training any point of time in India. We want to provide that physically as well as by way of virtual connectivity for distributing the equity in healthcare. So that's one part. Another thing which I wanted to highlight is that any country, as I said, will have a pyramidal structure for the healthcare requirement. There'll be people who are in the bottom of the pyramid who don't have access to healthcare, 40 to 50% of the people. Maybe 20 to 30% will have access, they will have money, they will have insurance and all. And 15% will be very rich and they can access healthcare anywhere. So the 50% who are in the bottom of the pyramid are the ones who have to be addressed when we look at equity. And what we have done in Aster is that we have 3 brands from the very beginning. One is called the Aster, the mother brand, which is to the middle income. We have the higher brand called the Medcare, which is to the upper income. But we also have a large lower brand, which is the Access brand, which is to the blue collar workers and all. So in any country, when we are looking at it, even in India, we are trying to do that for the lower income group. We have to have access rollout. We'll have challenges. There will be less profit. There will be huge issues regarding cost and all. But that is one thing which will really help the healthcare providers like us, and of course Apollo and all, which are much bigger, to provide healthcare to the people who are in the lower strata. And finally, I just want to tell that virtual care is going to be the most important thing which is going to help us, like what I mentioned earlier. Just to give an example, in the developing countries, 85% of the people with mental illness don't get any access to healthcare. That is something which can be solved by sitting in our comfort of our own offices, by our doctors who are in the developed countries or countries like India or other places where large number of medical professionals are there who can online provide the treatment to these people who have these mental health problems. So I'm just giving an example. There may be other areas where we can provide the consultation, but the medicines and other things have to be there on ground. But in mental health, mostly it is the consultation which is required. Just giving an example. So finally, I just want to tell that we should have the will to see that there are large number of people who are there, who require our service, but who are not having that. So the governments should see that the poor countries are funded, and the healthcare providers should see that we have services which can go into that. India is a huge example, like what Dr. Sangeeta said. We are the world's back-end pharmacy. We have provided, a lot of, vaccines and medicines to different countries. But above that, we can provide much more if the IP rights by the Western countries are lifted. And I was recently reading an astonishing thing where 169,000 was the cost of a dose of a medicine for something which was developed in India for less than $100. So that is the advantage which we can give to the poorer countries.
Sure.
And thank you very much once again.
Thank you, everyone. I think, thank you, Dr. Sangeeta. And I think to summarize, because we are just running out of our time, the concept, the foundation for partnering for achieving global equity in healthcare, I think that some of the key takeaways from our today's panel discussion, definitely, while we talk about a lot of statistics, a lot of issues, challenges which we have faced, but I think to begin with, I think knowledge sharing is a platform where inter-country knowledge sharing platform has to be developed. Technology integration, the technology has to be used as an enablement. The HR, human resource, and the clinical manpower is another area which we definitely, research and development, as Dr. Carlos' team has developed. There are thousands of such technologies can be evolved and can be commercialized for the development of the other national requirement. The funding of the healthcare infrastructure, again, that also will again come from a micro health insurance if we are able to generate it at a country level, and with the support of the global health insurance and as well as the reinsurance companies. The database of the healthcare knowledge, I think that's another very important point where Dr. Sangeeta mentioned. And then we are also talking about the inter-country regulatory aspect, which I feel personally that where UAE has been able to achieve a lot when it comes to the COVID situation, whether it was an approval of the drugs or whether it was a access of the healthcare resources from different countries. We were quite flexible, we were quite open to receive the ideas and act immediately. And I think these are the things which I personally, and based on the discussion with the eminent speaker, with Dr. Carlos, Dr. Sangeeta, and Dr. Ajad, I feel these are the key points which definitely we should look at it while we are talking and developing or taking the step towards development of the partnership for achieving the global equity in healthcare. I would be very happy to hear key questions. We have just a couple of minutes. We are already off the time. In case if any key questions which you would like to ask with the panelists, please. Yes, sir.
Good morning. I am Dr. Austin Demby. I'm the Minister of Health for Sierra Leone. Really impressive panel, and really appreciate all of the contributions and suggestions. As Sierra Leone being an example that Dr. Reddy presented as one of the countries with very low life expectancy and some of the challenges that we have around equity, I think for us in Sierra Leone, it's really important that we are all part of the solution. In being part of the solution, we really need to be at the table to have our voice very, very loud and clear. We are not happy about where we are. We want that narrative to change. And for that narrative to change, we have very ambitious plans ourselves. We want to take advantage of the opportunities that are presented with innovations, with newer technologies, with the human resources for health that we're looking at, and in general, to be able to look at health insurance capabilities in a tiered way to make sure that those at the higher tier have access, but also people at the bottom rung have equal opportunities. So we're here today in this forum, and I think we're actively present here, to see what opportunities we have, not to look at health as health expenditure, but actual health investments, because we care, and we have a common future. So I'll look at opportunities for insurance, I'll look for opportunities for technologies, I'll look for opportunities for research, I'll look for opportunities for human resources for health, and I want us to collectively own the response, collectively address the health equity issues for the world, for ourselves, and for you as well. Thank you.
Thank you, Doctor. Thanks for pointing it out, and I'm sure we will have a lot more opportunities, and we can definitely, once we are out from this session, we can definitely discuss, and then you're most welcome to connect with all the eminent leaders, even with Dr. Carlos, who can basically talk about the technologies which can be transformed. Definitely, I agree with you that these are the key foundation which I talked about for the successful or affordable healthcare infrastructure development, which you have pointed out. Anything else from the audience? We'll be happy to take the questions, please.
Deep, if there is no other question, may I make a brief comment, please? Because I believe the Honorable Minister made a very important point about absorbing and learning from the other parts of the world, but localizing the solution. And I completely agree that what works in one country may not necessarily work in another. And so the effort must be equally to see what is the best and to localize. So thank you for that very valuable insight, Honorable Minister, and we would be happy to share or ideate at any point of time on many of India's rural communities. In fact, my father's own village, where we've been working for the last 15 years to bring up maternal health and reduce infant and maternal mortality. Very happy to share any of those examples. I'll share my email ID.
Sure, ma'am. Thank you. Thank you, Dr. Sangeeta. I'm sorry, actually, we are running out of the time. I'm just getting a reminder.
I just wanted to, hi, sorry, I'm not sure if you can hear me.
Yeah.
I have a quick question. I really enjoyed the discussion by the doctors, Excellent. We all need cooperation, partnership, collaboration, to save humanity and the planet. I didn't hear anything about sustainability. I know health is important, but if there is no planet, how, what is the use of that health? How are you guys incorporating it into your, all this, these development strategies? Thank you.
Maybe, Dr. Sangeeta or Dr. Azad, one of you, please, sustainability is something which we have talked about, but I think application of the sustainability from the healthcare point of view is something very, very pertinent question. Thank you.
So I think it's very important, and Dr. Moopan spoke about ESG and the focus on ESG, which clearly incorporates environment and sustainability. In fact, only a day before yesterday, I visited a large plant where a small research team was looking at biodegradable materials and plastics. So all our pharmacy bags have actually been transformed into biodegradable bags. So we are step by step finding ways to enhance our sustainability, reduce our footprint and the pollution factor. But I completely agree with you that there's a long way to go.
Thank you.
Yeah. Just wanted to add here. So as a healthcare organization, there is a requirement for us to focus on many of these areas which are very important, not only from the environmental point of view, from the point of view of equity, gender equity, for example. There is a requirement to have more of women, more of handicapped people. So apart from the other areas like the usual environmental factors, the ESG sustainability, it requires for us to focus. And we are very much focusing on importance of conserving energy as well as reducing waste and for the proper disposal of the waste. And that's one of the most important things which we are focusing, and it's a very important point.
Yep. Thank you, Doctor. Thank you, everyone. Thank you for your time. And thank you, Dr. Carlos. Thank you, Dr. Sangeeta and Dr. Azad. And thank you, audience and the respected key guest for your time. And then we look forward to engage again and then happy to answer anything of the choice. Thank you very much.
The new normal, where we found fresh perspectives on life. where we faced unprecedented truths and discovered unimagined opportunities. A world where technology brings us closer, so we can learn from one another to co-create a better future. Where innovation isn't just centered on the new, it is designed to enrich what already exists. Where robotics and artificial intelligence accelerate the pace of upskilling, and genetics and biotech re-engineer life and its expectancy. Where our yesterdays build experience, and our todays generate resilience. Where we are all stronger together. And as we take a step forward, it's time to say, join us, make your mark. Welcome to the pioneers, the path definers, and the game changers amongst us. Welcome to a new way of thinking. Welcome to Dubai.
And a big thanks there to Sandeep and his panel, really putting it in perspective what's going on here, and particularly when it comes to partnerships, the importance for each and every one of it, be it government, be it private sector, the public and private sector, I think really showing what they can do together. We're now going to look at a very exciting topic that I'm really happy to be addressing, how the UAE managed to host the largest mega event despite the pandemic. That's our topic for our next session. So of course, a lot of challenges that we all felt right around the world. Again, the public sector, the private sector, it impacted everybody in every country. And still, we'd love to be talking post-pandemic. We're almost there, I would hope, but we all need to, it's not a time to forget about what's going on. We need to be cautious and we need to be very resilient, and we need to make sure that we're all getting towards the post-pandemic world. So a lot has happened, of course, and while we had to postpone Expo 2020 in the year 2020, we certainly have, and here we are, I think, on the final straight, the last 2 months of Expo, and it really has been an exceptional time. So it took a lot of work and it took a lot of planning, and of course a lot of work that went behind the scenes, and the concerns for the health of every visitor and the health of every resident and citizen who came here. So a lot of work has gone into this. So let me get my panel up here, and they're going to talk to me in terms of the work that did go into it, how they put it together, and indeed what they're planning for the future. So I'd like to welcome now the Assistant Undersecretary of Health Regulation Sector here in the UAE from the Ministry of Health and Prevention. His Excellency Dr. Amin Hussein Al Amiri is with us, so a very warm welcome to him. I'm delighted that he's joined our panel, so we'll have him sit with us here. Thank you so much. We're also joined by the Vice President and General Manager for the Gulf region here for GlaxoSmithKline. Gizam Akaline is with us. Gizam Akaline, so please, Gizam, lovely to see you. Excuse me. And also the President and Head of Gulf Cluster for Novartis Pharmaceuticals also joins us, Mohammed Ezeldin. So this is my great panel here. Mohammed Ezeldin joins us, and we'll get right down to business here and talk about the great work that has been done as we're looking at. Thank you so much. Now, Your Excellency, Dr. Amiri, when we look at, I think, what has happened in the UAE, it was really a coordinated big effort to deliver Expo 2020. The goal was there, the focus was there. It was always about keeping everybody safe, making sure that this event would be a success. And, I think we see that. But talk to us a little bit about the planning that went into this. It wasn't just a decision that said, okay, we're going to put it on, everybody come and do your best. I mean, there was a lot of work. So please bring us up to date and tell us.
Thank you very much. It's my pleasure to join at this nice summit. And I think this subject is very important, as my brother, Mr. Hamad, said, because the health is it's the most important issue for the human's life. If you are healthy, then you can have a productivity and you can improve the services. There are 4 main pillars in which supported our beautiful country, the United Arab Emirates, and specifically City of Dubai, in supporting Expo. Number one is the strong infrastructure which we had in terms of legislation, the laws, the policies, the regulations, which it supported the health sector sustainably to be strong enough. In fact, let me speak to you about one of the laws, law number 14 for 2014 for the public health. This law had an article number 32 which speaks that how the country should act at the time of emergencies and disasters. Secondly, the wish of the government, the support of the government to the community and to the healthcare services. And I'm sure, let me share with you a statement of His Highness Sheikh Mohammed bin Zayed Al Nahyan, the Crown Prince of Abu Dhabi. He told everyone, to the community of UAE, La tshil ham. It means no worries. This is something that you have a government which supports the community. And third, I can say, you, the people who lives in this beautiful country, we are almost 200 nationalities living in peace in this beautiful country. Those people supported us in terms of following the guidelines, following the restrictions, following the rules and regulation. You are the one, ladies and gentlemen, who supported us for the sustainable quality of services in the UAE and to make sure that we were able to protect your health, your family members, and also this allowed the success of Expo, that millions and millions of the people to come and attend Expo, and we are so proud that we have Expo Dubai 2020. And I will end by saying that another example was Arab Health, which was last week, and we had 3,500 companies with above 40,000 participants within 4 days. And that was the beauty of the UAE and Dubai in supporting the human's health and in allowing the investment, the companies to join us, the people to come and visit us, and also allow the international pharma and medical companies to come and join us and expand their investment here in Dubai and to cover more than 42 countries from Dubai itself.
Again, yes, and I think people realize the importance, you know, of that and the effort that went in, and indeed the success that it has been. So long may it continue. Gizam, when we look at the consultation that is necessary by the pharmaceutical companies, to talk to us perhaps about the advice that you can give a government, you know, in times of crisis, particularly like the pandemic in the last couple of years.
Thank you very much. First of all, thank you very much for the opportunity. I think as multinational companies, I don't see multinational companies and governments as two separate entities, but quite partnerships that would make really successful management of not only the pandemics, but generally management of different diseases or prevention of diseases in general. And in that respect, I would like to give a specific example about the UAE, which we have done an amazing example during this pandemic period. UAE is in the second country in the world who have within 24 hours access to the medicine, which would be a life-saving product. And that is for me a very good example, very specific good example of how a government can partner with the pharma industry to create a solution. So for me, I may not say advice, but the close collaboration and partnership is the key thing.
Again, and what they talked about in our opening panel too was very much the importance of that partnership, because everybody needs to be on the same page and again with the same goal in mind, and that's really when it comes alive and everybody can work together. Mohammed, talk to me when you look at the role of a global pharma, again when it comes to helping a city to make sure that really it's the health and the safety that's number one. What can you do?
Thank you very much, Edna. So I think very much honored to be here to start with. I think the pharmaceutical companies and the global multinational companies played a crucial role in ensuring the safety of the cities and the countries around the world as well, and specifically in terms of the pandemic phase. And there are plenty of examples, but then the most important one that I believe everybody is aware of, and we can witness that in UAE as well, is access to innovation. And a great example was the partnership that the multinational companies had with the Ministry of Health and Prevention to ensure that state-of-the-art vaccines are available in UAE and almost at the same time that they were available in the country of origin or in the manufacturing country as well. So we have plenty of examples about vaccines, about medicines or medications or treatments for the pandemic, for COVID-19 as well, and they were available almost at the same time of our counterparts in Europe and US as well. So innovation, access to innovation is a crucial role that multinational companies are playing to ensure the safety as well. The second point is awareness. And then, of course, the availability of vaccines is something, but then ensuring that the public is aware that the vaccines are extremely important, that everybody should go for vaccination is something that, again, we played a role with the Ministry of Health and Prevention. There were a lot of programs that we worked together to ensure that the public awareness is secured as well.
Talk to us, if you would, Dr. Alamiri, about the importance of that partnership. And again, we're using this word, I think, in a different way, perhaps, that we might have used it 5 years ago. There might have been a different relationship there. But how important was it that the multinational companies and, again, the Department of Health and Prevention, come together to make sure you're headed in the right direction?
Thank you. That's a very good question. Let me elaborate on what Gisam said. I mean, Gisam said something very beautiful, and this is an example for the rest of the countries that UAE, it's really a model. The medicine which called Sotrovimab, by the way, I'm not marketing for their medicine, the GSK, but this is the truth of the reality of United Arab Emirates. The medicine called Sotrovimab for the treatment of COVID-19, it was approved by FDA on 27th of August, 28th of August, it was registered, approved in United Arab Emirates, less than 24 hours. A vaccine called Moderna, it was approved just in 4 hours in the UAE. We were the only country in the Middle East and Northern Africa that we started the clinical trial for COVID-19 vaccine called Sinopharm, 54 healthy volunteers. And this is the beauty of the outcome of this country, that we have a great support from the community, that they joined us in organizing such clinical trial, phase 1, 2, 3, with 54,000 healthy volunteers. And this is an outcome of the strategic partnership, as you asked me a question, between us and the international pharma companies. I do remember in 2010, we had just 34 international pharma companies. They have a base in Dubai itself to represent their international pharma companies to cover almost 41 countries. By end of 2021, within just 10 years, we reached 91 companies. They are covering more than 85 countries from Dubai itself. That's the beauty of the UAE. This is the beauty of Dubai, that really we are supporting the international pharma and medical companies and their logistic hub. They are here. And this supported us, by the way, my sister, that all the countries, even some of the developed countries, face shortage of medicines, PPEs, and sanitizers. Despite UAE, we did not face a shortage of not even a single tablet, because we had a strategic partnership 6 years back, before the COVID, with all pharma companies, that 30 to 40% of their strategic stock has to be reserved to the UAE. And that was the beauty of the pre-plan of the UAE, to be ready for unexpected emergency. And today, I'm saying that we are working strongly with our partners, and we thank them that they are here with us, they are supporting us, they are having their international offices are here and logistic hub, and really we love to support them more and to allow others to come and join us.
And also, I think the great thing, the UAE was in a position whereby it could help other countries as well. So that effort, I think, again, has to be commended. Gisam, talking about, that supply chain that's there, how can pharma companies help perhaps build the resilience into, I don't know if they can help countries become pandemic proof in the future, but again, you can certainly do a lot in terms of building resilience. Talk to us about that.
Thank you, Etna. I think, pandemic proof is, I don't want to call it utopia, but I hope it will happen personally as well. So I think we have got different roles here. First of all, pharma companies, we need to start from our strengths. And our strength of these multinational companies or innovation-based companies is working on the innovation continuously and bringing access of new, innovative, better medicine, treatment, vaccine earlier to the public. And I think pharma industry has done a good job there. When I have started 20 years ago, the average time frame of a new innovative medicine to be in the market from an R&D perspective is roughly 8 to 12 years, which has been shortened dramatically. And in the pandemic, we have seen that it's massively, massively shortened. And the second piece is pharma companies. We've seen more collaborations among different pharma companies to generate a solution for the countries, for the public, to have earlier access. So it's not me or you, or the competition is more healthier, and more collaboration is on the table among the pharma companies as well, with different sizes, with different initiatives. On the other hand, the governments, the countries are the ones whom are building the ecosystems. And the better the ecosystems are, from its technological infrastructure, from its rules and regulations, from its investments, from its strategy, from its encouragement. So all of them are part of this ecosystem. If they are built in a holistically and synchronized manner, then the collaborations would be more fruitful. So I think, first of all, pharma needs to do its job, bringing new innovation earlier and more. And then we have to set as partners and how we're going to be helping our citizens, patients, or public to make it available. The better, the earlier. And we have different roles here, so we need to support the governments with respective medicines, access, training, and the countries or the governments will, with the pricing policies, with its infrastructures, with its pace, with the collaboration. So it's a mutual effort. But I think we have to play our roles as needed, I would say.
And indeed, again, good that cooperation and that, ties are there with the government, but also among each other. And Mohammed, I think this brings me very nicely into a segue, because not alone are you looking after Novartis, but again, you look at the umbrella association in terms of what the sector can do. But talk to us, I think, in light of that too, about, public awareness and education, because there's a lot we can do as well, but we sometimes need maybe a little bit more public awareness. We need more information and education from all of you.
I think, Etna, what Dr. Amin mentioned and also what Gizem mentioned summarizes it all. I think the key point here, the key word is collaboration and partnership. So for us, we cannot do it alone. It's obvious, as you said, Etna, that the cooperation between the pharma companies and the industry association that we have is a very good example for that. The partnership initiatives that we had as well and the encouragement that we had with the Ministry of Health and Prevention in UAE is another example. And then also the public and the contribution of the public and the importance of the public awareness played an extremely important role as well. And if you look at the phase of the COVID-19 pandemic and what happened in UAE, from day one, the pharmaceutical companies were encouraged by the Ministry of Health and Prevention to sign MOUs to set patient support programs, and these patient support programs provided a lot of support to patients, educating them about how to manage their diseases during the vaccine. Because we need to remember that it's not only about the COVID-19 as a disease, but also that those patients suffer from other diseases. And then how can they manage these diseases? How can they get the injection self-administered at home? And these kind of patient support programs played an extremely important role in educating the public about not only managing the pandemic, but also managing their diseases and surviving with these diseases as well.
Indeed, and I think we all need to look at that more holistic. Please, come in on this, because I think the work that you put in advance to make sure that all of this was happening, that public awareness, the education, there's so much that we all need to be aware of.
Yeah, thank you. As my brother, Mr. Mohammed, said, we as a Ministry of Health and Prevention signed almost 17 MOUs with different pharma companies. And the major part of those MOUs is to support the patients while they are at home, and especially, it's not the COVID-19, because the most important are the patients with the NCDs, with the non-communicable diseases and with chronic diseases, how to help them to let the medicines to reach at their home, how to support them, how to do a sort of testing and follow up from their physicians, and how to use the wearable items that we can monitor their ECG, we can monitor their blood pressure, how they could be connected online by using the new digital technologies, and how to support them in terms of the public awareness and education, how to use the medications, how to follow up, their health with their physicians. This is like an ecosystem. The entire program between all the pharma industries and the government to support our patients and not to expose them to the risk and not to allow them to come to the hospitals. And that was the beauty of the partnership between us and the private sector.
If I might just, keep you in this sort of theme in a minute, because you mentioned, the concept of maybe technology in there and how it has helped. And again, how we really need to look at this. We can't look at the pandemic in isolation. We have to really look as, citizens and residents at, the bigger health story. But talk to me about how technology has shifted in terms of connectivity, in terms of transparency and that awareness. How important has that been?
I think digital health is the future of the healthcare sector, for everyone. And we started with the digitalization almost 5 years back, and we started with the robotic system to be introduced in providing different type of surgeries. I will give you some of the examples. We were the 4th country in the world to introduce a robotic surgery machine, which called Da Vinci, for the open heart surgeries and for the urology cases. We were the first country to introduce the smart applications to serve our community, like UE Radar for the pharmacovigilance. We have a smart application which was launched by His Highness Sheikh Mohammed bin Rashid Al Maktoum, Vice President, Prime Minister, ruler of Dubai, and that was on 27th of January 2020, during the Arab Health. That smart application is called Hayat. Hayat, it means the life. It's in your, you can download it. With 3 steps, you can be an organ donor. With 3 steps in 2 minutes. And during the Arab Health, I'll give you another example. We were showing and launching the new smart application for the paramedics with the Dubai ambulance and the national ambulance of Ministry of Interior, that the paramedics, whenever they reach to the houses or the offices or the places which the injured people are there, they can do the ECG, and instead of sending the ECG to the cardiologist to read it with 12 lines, their mobile application, their mobile, can read the ECG 12 lines in 10 to 20 seconds. It's a company from Israel. We have a partnership with them, and he can have a report of the case of that guy. We will be saving time, we will be saving money, we will be saving a lot of things. I will give you a last example. We introducing new technology, something called augmented reality. What's the augmented reality? Augmented reality is that many people, or all of us, whenever we use any type of medicines, even for treatments or for the well-beings, today we are speaking about well-beings, and mainly the female, which they are using anti-aging pills or supplements. Now the majority of the people, we found that 80% of the people, they don't read the inner leaflet to know about the medicine. Nobody reads it, and that's wrong. Now we introduce a new technology with a company called Ferring. There is a QR code, not a normal QR code, at the outer pack of the medicine. You just download the application, you put your mobile, read the QR code. With 3D dimension, a lady will come to you and will speak to you about the medicine. Will tell you what's this medicine, how to use it, what's the contraindication. Any questions you have, you just click on the circle which it talks about the medicine, and the lady will speak to you. And this is the reality. I can do the transformation of the digital technology in a way to serve my community. And we will be, by the way, the first country in the world by the second quarter of 2022 to introduce this technology. And we found other companies like Pfizer, other companies that would like to introduce that technology. And that was the new initiatives. And I can say innovations that always the government of UAE look forward to it, and mainly Dubai, that we would like to introduce those technology. I will give you a short explanation of that augmented reality, that the outer pack of the medicine will speak to you.
Yes. No, I like that, because you're absolutely right. How many of us do read all of that paperwork when we take it out of the packet? Probably yes. not do a great job on that, which we probably should. So now we'll be just able to use that QR code. It helps us, but again, it's about helping people, and it's about being proactive. And again, when we look at that technology, you know, Gizem, technology I think has really helped us here in Dubai, and I think, you know, when people abroad look at just, you know, the apps and the Al Hassan and all of that, you know, they're amazed at the efficiency. And this is great in this region, but what can the pharma companies do, you know, globally to make sure that the rest of the world is brought up together, so to speak?
I think we have got, so the governments and the pharma companies has mutual responsibility on this, because in the world there are different let's say levels of wealthiness in different parts of the world, and unfortunately not all the citizens, or not everyone, has access to the medicine. So what pharma companies could do is, of course, you know, innovation, building up, and when we see that the innovation is being built up, actually the innovative medicines are found and produced like 10 countries in the world, where we think about 8 billion people. So we have a responsibility on that. And I could give examples that we could have some collaborations with the governments for better prices, or I would say reduced or more reasonable prices to access the medicine in these countries, which, as an example, GSK has been doing, like with Gavi collaborations, or, you know, we have got market access index all over the world, which we are trying to do our best, as GSK is one of the, you know, companies we're trying to do for all the countries. But it's not only you know, reasonable prices or collaborations. I think we have got challenges as well. And the governments are supporting other governments as well. One is education, the other one is infrastructure. So we were talking about technology, infrastructure. So some of the medicine, if you don't have the infrastructure, it may not be possible to make these products available. Even in some of the countries, you may not find the storage facilities that's been needed for cold chain products, for instance, everywhere. So I believe it's not only pharma giving access to the medicines at a better price, so it is one part of the story, but it's a more holistic problem, as the overall, I would say, needs to be managed with a bigger politics, I would say, because it's a little bit challenging. But of course, as multinationals, we should have to do or play our part as best as we can.
Mohammed, have a quick maybe look at the lessons that have been learned. How different, you know, will the pharma companies work in collaboration, you know, as we go forward? I mean, ultimately hoping that we can prevent future pandemics, but we must have, things must have changed for, you know, even the big corporates like yourself.
Absolutely, Edna. I think this pandemic further strengthened the collaboration between companies as well. Not only companies with the health authorities, but also among the pharmaceutical companies as well. We've seen many examples where companies collaborated together in terms of like providing manufacturing facilities. Like, for example, we provided the manufacturing facility of Novartis to somehow support the production of one of the vaccines on a mass level as well. We've seen partnerships between pharmaceutical companies and universities, pharmaceutical companies and startups. So these kind of examples for collaborations is something that we have seen like getting further strengthened and materialized during the pandemic phase as well. And I believe that the pharmaceutical industry role will be crucial in the future as well, to ensure that the time to innovation is even shortened. So sometimes we do not have the luxury to wait for like years and years to bring like an innovative medicine or a vaccine. And we've seen that happening, for example, like building on an existing concept or technology and bringing a vaccine as soon as the companies could as well. And I think last but not least, what's really important is that the technology, and certainly Dr. Amin spoke about digital health, so incorporating AI technology in terms of accelerating access, in terms of bringing innovation even faster than before as well.
Yeah. You were close to wrapping this up, so Gizem, if you could maybe give us a few words in terms of what people need to do now. What can we learn? We're all here at Expo. This great event has happened. We've only 2 months left on it. And again, hopefully many people from other countries can, you know, get the vaccines and come and visit us. But what needs to be done now, just in a quick wrap up in terms of a call to action, perhaps?
I think for pharma companies and governments, we need to continue collaboration and partnership approach, even among the pharma companies. So that's one thing that we learned, and we need to continue and even accelerate or enrich it. And as citizens, I believe, the pandemic has educated us as well on many aspects. So we need to be mindful. I hope this pandemic is the last one, but I have doubts around it. So new things might pop up in the future, and we need to be very mindful of how well we can manage these situations as a whole together. So we need to be mindful about it. I mean, this education piece needs to be more embedded.
Mohammed, just a quick words of wisdom from yourself.
Oh, I wouldn't add much to what Gizem mentioned, but I believe that the corporate social responsibility of the companies as well will play a very important role, because one of the lessons that we learned from the pandemic is that not only the countries that will have access will contribute to managing it, but there are also countries that should not be left behind, and then the companies should play an important role as well, not only the governments, to provide broader access to the innovative vaccines or medicines to those countries as well, because then we will do it together, all together as the whole world.
Now, Your Excellency, Dr. Alamiri, I kept you for the end because I wanted you to give the closing word, but I also know you do want to comment on something Mohammed had said, so I'll let you do both.
Thank you very much. I think I will conclude in raising in a statement of His Highness Sheikh Mohammed bin Rashid Al Maktoum, once he said that wherever the brains goes, some changes will happen, improvements will take place, prosperity will come to that place. And therefore, and I think it's very important here that we learn the lesson from this pandemic situation. The lesson is that we need the cooperation of everyone. You did great as a community of UAE with different nationalities. You did great that you supported our government, you supported our country, you joined us with these efforts. But I think we need, again, more and more, because this will be for the sake of UAE community. We need you to give us your ideas, your brains to give us the ideas, your innovatives, your suggestions, solutions that it could help us to improve our country. And I think by the integration of the efforts from all the communities, we will be able to serve you, to provide you the highest quality and high standard of healthcare services, and to make sure that you will live in this beautiful country in peace and with healthy situation and good well-being. Therefore, we ask you that please, whatever is in your brain, leave it here. And if you decided to leave, don't leave us. If you decided to leave, leave empty. You know what's the meaning of leave empty? Take out your ideas, your initiatives, your brains, your good things. Put it here. Let us share it with us. Let us improve our country and to be the best. Thank you very much.
And what a lovely, optimistic, encouraging note to close on. And again, I think it's, I think it's great to hear this coming from the Department of Health and Prevention. It's not just about the cooperation with the big pharma.
Ministry of Health.
The ministry. Because again, this is where, it's at the very heart of government, of the country, of what you're all doing. And to see that great desire, as I say, not just to cooperate among yourselves, but to make sure that you get that wisdom and you get the involvement from the people who've lived through this and who probably have some great ideas that they can share. I really want to thank my great panel here, Your Excellency, Dr. Alamiri, thank you so much. And again, thank you for sending us off with a very inspiring message of great hope. Gizem also from GlaxoSmithKline and Mohammed Ez from Novartis. Again, thank them all for being with us. It's really been encouraging. And again, it's left us on a wonderful note there. So stay with us. We will continue. We're going to have a quick video right now, and we'll be back very, very shortly looking at building a culture of health at the workplace during COVID and beyond. And Rachel MacArthur will come back with her panel to start that and really look, and she'll be right with you in just a couple of minutes. Thank you so much. Stay with us. Yes.
The new normal defines a bold new coming of age, where connectivity redefines boundaries to markets, and information is the most tradable asset, where omni-channel commerce is a necessity, and the only differentiator is digital agility, where trade routes are continually reconfigured, where sustainable logistics are dramatically reimagined, and open competition is the most successful modus operandi. A community consciousness has grown to align with our responsibilities as a society, where human connection sparks dialogue and collaboration ignites open-mindedness. And as we take a step forward, it's time to say, join us, make your mark. Welcome to the city of spontaneity and consideration. Welcome to the city of limitless opportunities. Welcome to Dubai.
Your Excellencies, ladies and gentlemen, our delegates, and hello to those who are tuning into our live stream. Good morning, I hope you're having a happy and productive day so far. My name is Rachel MacArthur. I'm the founder and managing editor of Digital Ink Media here in Dubai, and I'm also a medical journalist by trade, so needless to say, it's very exciting for me to be here at the Health and Wellness Business Forum. Now, this session is one that, in my opinion, is quite important because now that we're back into the swing of some things, dare I say it, we've started to kind of neglect wellness at the workplace again. Now, I'm talking, of course, about building a culture of health at the workplace and how we need to continue the momentum. Now, joining me for this session is a panel of experts from government to private sector to discuss where we're at, where we're heading, and just what needs to be done to ensure we live healthier and happier lives. So, without further ado, we're going to be welcoming, first of all, His Excellency Stephen Donnelly, Minister of Health for Ireland. Welcome, Your Excellency. Welcome. Also joining us is Maria Fernanda Paez Silva, who's the R&D Hygiene Operations Director for Africa, Middle East, ASEAN, and Greater China at Reckitt, the famous makers of Dettol, where you've been seeing everywhere at Expo. Welcome, Maria. Hello. And if the technology gods are with us, we also have two special guests joining us by live link. First of all, I'd like to welcome Dr. Jamila Mahmood, who is the Special Advisor to the Prime Minister of Malaysia on Public Health. Hello, Dr. Jamila. Oh, there you guys are. Hello. And we also have Yunus Vikstrom, who's the head of ISKU Middle East for ISKU. Hello, Yunus. Right, so let's get straight into it. Now, workplace wellness. I think it's something we've all discussed, and we kind of know where we're at and we know what the answers are. But Your Excellency, actually, the first thing I'm going to ask you, and considering you kind of took your position right in the middle of the pandemic, how has the pandemic shifted workplace culture?
I think it shifted it quite profoundly in the short term. The question is, what happens in the medium term and the longer term? Can we seize the opportunity? In Ireland, as in many countries, probably the single biggest change was working from home. Yeah. And it was something that was really forced upon us all. There had been efforts to have blended working, maybe 1 or 2 days at home, but it wasn't something that was being broadly supported, I think, by employers, including by state employers. Then we had a situation where almost overnight, everyone had to work from home, which came as a big shock, particularly when we had to start educating our children at the kitchen table at the same time as being on Zoom meetings. But we all discovered, actually, you know, the VC world and remote working world, and for a lot of people, that was very positive, particularly when the children went back to school. That made it a lot easier. And in Ireland at the moment, actually, we're now in a phased return to the workplace, sort of post the Omicron wave. And a lot of employees are saying, well, yes, we want to go to work a few days a week, but we really want to work from home a few days a week as well. So I think there's a really important opportunity here, and it's a societal opportunity. It allows people to work, to live in more rural areas. It allows for a better workplace balance. You know, if people are commuting an hour a day each way, well, that's, you know, up to 10 hours of their week that they get back. So I think there's some very important changes there that we need to hold. In healthcare, it's been the opposite. In healthcare, the pressure and the stress on the healthcare professionals has been immense. It's been incredibly difficult. I think the best example for me is I had a conversation with 2 critical care nurses who had several decades of experience. So these are hardened, experienced healthcare professionals who've seen every manner of disease. They've seen an awful lot of people in very difficult circumstances. They've seen a lot of their patients die. And they said what they went through with COVID has left them traumatized because of how vicious the disease is. And the fact that when people were suffering and in many cases dying, they did so alone, surrounded by people in suits, you know. And so I think in healthcare, they've had an extraordinarily difficult situation. And one of the things we're trying to do, and I know health ministers I speak to internationally are trying to do, is say, well, let's use this opportunity to make sure that there is a renewed focus within the healthcare world, not just on physical health and infection prevention and control and antimicrobial resistance and so forth, but on mental health, on wellness, on well-being as well. So I think we've been through a time of extraordinary change, and I think there's a lot of opportunity for us to hold, and I think there's a lot of urgent need within sectors like healthcare that it is essential that we start moving on and acting on to protect our healthcare professionals.
Yeah. Dr. Jamila, I'll come to you next. You just heard what His Excellency mentioned. With regards to, that's kind of the Irish perspective, but also a global one. In Malaysia, how has it been going for you? You advise the Prime Minister on public health. Are you in agreement with His Excellency?
Thank you very much. It's a pleasure to be here, albeit virtually. Just a minor correction, please. I've since left the advisory role and set up the Sunway Center for Planetary Health, but certainly I can reflect on the question. I mean, what His Excellency mentioned is spot on. I think the impact on the health workforce has been tremendous and something that we need to think about very carefully, because future generations of healthcare workers may be dissuaded from actually getting into intensive care roles. In fact, a lot of the healthcare workers have been burnt out and in many countries have left their professions. In Malaysia, we've been very fortunate because we have such a dedicated health workforce who have stayed on and also reinforced by civil society and other actors. So this is a real threat in terms of the future of the workforce. I want to reiterate one point, though. This is not going to be the last pandemic. In fact, what I wanted to talk about was really how we need to reflect on why we are in this situation now, the drivers of the pandemic. And until and unless we also take a longer term vision and some strategies to address the anthropogenic impact on our environment, on health, then we will be seeing more and more of these outbreaks and diseases emerging, and we will continually be caught unprepared and we can't catch up. So behavioral change is extremely important, and businesses and governments have to put in place policies and measures that will really look at a broader concept of planetary health, the impact on the environment, our ESGs, behaviors, and so on and so forth.
And that's such a good point, because we always think of COVID, as much as we'd like it to be the last pandemic, so to speak, it is the reality is we should expect more, and we should be ready to expect more. Your Excellency, actually, I'll come back to you for a second. Is there any prep for that? Do you feel that we're going to have more pandemics in the future?
Well, I certainly hope not, but we have to act on the assumption that we will. We have to act on the assumption that COVID is by no means over. It would take a relatively minor mutation of the Omicron variant or another variant of concern to emerge, maybe with greater severity, greater immune escape, and we'd be back into a very serious situation. Or certainly some of the scariest conversations I have are with virologists who talk about other diseases, other viruses that are out there with much higher mortality rates that they're hoping won't break through into large-scale transmission. So yeah, we must act on the absolute assumption that very serious other waves, be it of COVID or other viruses, will come, and we've got to put the global defences and the national defences in place to be able to deal with that.
Yeah, so basically one of the key learnings is that we shouldn't forget and we should continue expecting the worst, so to speak, even though it's not the greatest outlook, but still, it's good to be prepared. Maria, I'll come to you now. I'm sure you're one of those people who are working from home, and I know you have a son, correct? Were
Yes.
you juggling both of them at the same time as everyone?
Indeed, that's the case.
So within your role, obviously Dettol has been at the left, right, and center of the pandemic, and there's no doubt that your entire workplace know how to wash their hands correctly and use sanitizer and whatnot. But in terms of other workplace initiatives, what did you see introduced over the past couple of years, and how has the workplace shifted, so to speak? How has culture shifted?
So indeed, as you were mentioning, the culture at the workplace is changing and has changed massively over the last 2 years. And I think that one of the big things has been the increased awareness on the importance of mental health and well-being in general, right? Boundaries have been blurred through the past 2 years. We started to work from home, as His Excellency mentioned. And as we were through that process, I think that it was super clear that we needed to learn to put boundaries still and to preserve our mental health and our well-being. And we became more aware of that, and I think that companies have also put a greater effort into driving that awareness. No? Now, it is still as intense, that effort, as it was before. I think that it's maybe what we need to reflect as corporates and make sure that it doesn't go away too fast, and that we are keeping that education and keeping that role model as leaders of organizations in order to make sure that this remains top of the agenda, right? And that we keep those learnings that we got through COVID as a long-lasting change and as a long-lasting impact in the cultures of the organizations.
Yeah. Lovely. Yunus, coming to you next. I would like to know, how has it been for you guys as well at ISKU? How has the workplace culture treated you recently?
Your Excellencies, Rachel, everybody else, thank you for the opportunity. So, ISKU is a furniture company, holistic furniture company, and we are furnishing homes, working interiors. So we are seeing both ends of this equation. And the change has been drastic. People have gone home from workplaces, but on the other hand, they have started to put effort and resources and spending to their home and remote working stations as well. This is one kind of phenomenon that we have seen. So those working conditions have been improved at home, but also general furnishing and decor. That's also something, because people are just optimizing their well-being, and while they are restricted from traveling, they are putting much more spending to their homes and sleeping, for example, as well. So the change has been huge that we have seen. Given that we are also in this antimicrobial field, we have started that development process from 2013. So we saw the world before pandemic from this antimicrobial point of view. So there was also a huge change. And we had already the reasoning of putting resources and considering hygiene in normal workspaces already before the pandemic. But of course, now when we have this global pandemic situation going on, these same topics are now being listened very carefully. And the situation has changed a lot.
Yeah.
But I think in a way, this is a really good wake-up call and like a reminder that these things, they occur every now and then, and we need to be prepared.
So I feel the common theme so far has been we need to be prepared. Preparation is key. Prepare for the best, prepare for the worst. Now we've got to address this. Actually, I'm curious to know, I'm going to turn to the audience for 1 second. And you don't have to show up your own workplace. I'm just going to ask, overall, do you think workplaces are continuing to adopt well-being practices such as, reinforcing the importance of mental health, or do you not? So if you think companies are still being great and doing so, put your hands up. Does not necessarily reflect your own company. I think we've got about 1, 2, 3, 4. Okay, safe to say that's the minority, and I'm assuming that the rest think that companies are not being held accountable. Is that correct? If you agree with me, put your hand up. So companies need to be held more accountable. I think that's the majority we have here. So the right workplace wellness programs can boost productivity and change a company's culture for the better. But as mentioned, many have been accused of having a program just for PR purposes. We're doing this and that, but when it comes down to it. In fact, one recent survey actually showed that 60% of large employers say it's important to achieve a culture of health at work. However, only 20% are achieving it. So from a private perspective, Maria, as someone you're just working at a company, how is it that regular people like you and I can keep these big multinationals accountable, and how can we ensure that wellness at work is taken seriously?
I think it's a very fair point, and I think it comes from the authentic actions of the leaders and the real commitment top down on making those long-lasting change. And I believe that we are called out when we don't walk the talk, and that's why from leadership point of view we need to set the tone and also lead by example. And I think that it comes by stopping overvaluing the overworking and the present teams, and as a leaders start admiring, putting those boundaries and giving the people the space in order to recharge, to reconnect with their own values and their own needs, and then come back re-energized to work in a day-to-day setting. And it's small practices, but it's okay as a leader and as an employee to, in example, reject meetings that are conflicting with your personal time, or book time through the day in order to do whatever re-energizes you. I have done it myself. I have ring-fenced time in the mornings to exercise and to do the school run, because for me there isn't anything that boosts my energy more than the hug of my son when I'm dropping him at school. And I'm being transparent with my team about that. I also encourage all my team members to do whatever fulfills them. And I think that is that vulnerability, that trust and mutual accountability what really will instill this culture for the long term.
I love that, mutual accountability. And I just think, yes, it's very true. If we all do it together, the more we push back, not that we're slacking, but the more you actually tell them, please respect my boundaries, then the boundaries will be respected. Jonas, what's the Finnish workplace culture like? I mean, are you a group of overworkers, or are your boundaries respected?
I think Finnish culture is very well being focused. We have a lot of like employee benefits, and the whole culture is promoting well-being and being active, eating healthy, and these types of topics are very, very much like discussed now. And of course, we have a high level of social security and taxation comes with it. So many things are also compensated via taxation. And so we have a really common practice of having these lunch benefits. We have compensations for cultural and sport activities. And I think the recent kind of benefit that was introduced was a bicycle benefit, that it's compensated if you're purchasing a bicycle, what you're using for your commuting. So I think Finland is a way forerunner in this field.
Nice. I like the bicycle benefits. Not sure it will work here given the weather, but I like that. That's really nice for you guys. Maybe they can do that with gyms here. So Dr. Jamila, we touched upon companies, businesses. Now the role of governments I'm just curious to know, how far should governments go towards holding businesses accountable? I mean, should governments be supervising businesses and telling them, okay, this is what you need to do, this is how you need to take care of our people?
Yeah, I think that it's everybody's business, right? Not just government. I mean, government policies in terms of human capital is clear. There are legal sort of bylaws and legislation on welfare of the people, but I think COVID has really tested whether that is enough, and I think it's not, because work from home culture is not something that is easily practiced in this part of the world. Probably in Finland and Europe, I've lived in Europe for many years, that it is quite normal for women particularly to be able to also work from home on certain days, and you don't have to be in the office all the time. Which brings me then to looking at the challenges we have in workplace from not only large organizational perspectives, but to acknowledge that there are gender dimensions to this as well. Women are, more impacted by crises, and even working from home adds a different level of burden for women as well. On top of their normal work, they have the natural tendency to care their caregivers. So the caregiving community is really under pressure. Added to that, I think that in countries like Malaysia, we also have to look at it from the perspective of what are people doing. It's not large corporations, it's small, medium enterprise that is driving the economy in the country. So what kind of workplace changes to the workplace will then be in place to cater for that? And I want to put, the elephant in the room. What about migrant workers who are in countries like Malaysia or other countries in the world? How do we make sure they are also protected? What kind of compensation? Even things like sick leave and paid employment when they're ill. And these are things we have to think about more broadly. And I think it was mentioned before around mental health. I think this is the hidden pandemic that has become uncovered with COVID-19. And I think any workplace now has got to look at not just the physical attributes. You're talking about ventilation and simple things like that, which means government has to look at a whole range of approaches from building design. Our buildings are not designed to be well ventilated today, because of air conditioning and so forth. What are the innovations now that needs to happen? How do you create a compassionate workplace that will take into account the needs of protecting mental health? How do we actually look at, the special needs of women in terms of creating that environment that is healthy for them and the caregivers, so to speak? So I think, one of the ways is really looking at the carrot and the stick, the incentives for businesses and workplaces to have those changes, but also the disincentives when you don't. So I think this is something that you cannot look at only in the health perspective, but I think we've also got to look at it from the whole climate crisis perspective. The implications are similar. So, so I think it's a very big step back, I think governments have to take and look at a very holistic approach to this.
Yep. Minister, do governments need to take a step back and look at what they're doing right now?
Well, governments need to lead. Governments set the rules. Governments set working conditions. Governments set maternity leave, parental leave, sick pay, pensions policy, minimum or maximum working hours, overtime rules. Obviously, employers have a key role to play, but governments ultimately set the rules. Governments lead by example, so governments are the biggest employer in most countries, you know. So how do states treat their own employees? Marketplaces are competitive. So if you set rules which lead to healthy workplaces within the state, and I think, as was just said, it's not just about physical health. It's not just about being able to cycle to work or work from home one day a week or go to the gym or have healthy food at work. It's about mental health, and it's about something probably a layer deeper than that as well, which is security and stability in your life. So as a mother or father, can you take time off to raise your children? How much time can a woman take off for maternity leave? What's your pensions policy? So one of the big intergenerational shifts we have now in Europe is younger people are growing up without secure pensions, without secure jobs. So none of this will work unless governments take it very, very seriously. And for me, it's not really about holding companies to account or employers to account. In a way, it's simpler than that. We set the rules. And so if governments set the rules in an unhealthy way, a way that disempowers parents, a way that means people feel insecure in their role, that they can be fired at any moment, that they can't take any time off, that they don't have a secure pension, etc., then there's very little that employers can do. So I fully agree. Governments are largely responsible for making sure that the environment and the laws and the rights that workers have are conducive to physical health, to mental health, to spiritual health, and to having security in your life, which I think certainly in Europe, for a lot of younger workers, there's a lot less security there than there used to be. And the only people companies are not going to reverse that. The only actors that can reverse that are governments.
Yeah. Now touching upon the theme of governments, data obviously is coming into its own in healthcare. And I'd like to quickly ask about population health management. Now, it's an area that many companies are beginning to explore as it can reduce health insurance costs, for example. However, on the flip side, it can be argued that population health management is somewhat controversial in the workplace because it can encourage discrimination. So if I have, for example, a type of genes, my DNA that can puts me at risk of, I don't know, type of cancer, then the insurance will know ahead of time. So I just wanted to know, and I'll come to you first, Dr. Jamila, what's your opinion on population health management, and what does it mean for an employer and their employees? Is this something, the data gathering, what do you make of it?
You know, I think the whole issue on data we can talk about it for the next day. I always smile when people tell me about data protection, because yes, it's extremely important, but on the other hand, when you have a smartphone and you start using that and buying things off social media, I think you have to ask yourself about how much data protection you already have reduced. But it is very important. I think that, you know, it's all about how you engage with your employees, right? In the sense that, you know, population health management is actually about trying to improve outcomes for the employees. So, you know, it must be on that basis that you want to improve individual health and also improve care coordination. I think this is really, really important. In developing countries like, or middle income countries like Malaysia, you know, we don't have the benefit of a broad insurance system for the public. In fact, a lot of the healthcare is completely subsidized by the government, which is unsustainable. So how do we now put health into people's hands? I think this is very important. Individuals taking charge of their own health, and that comes with a lot of need for education, using digital tools, really bringing in the technology, so that as we merge health with AI technology, empowering citizens, I think that is the way forward towards wellness and health. And it's a long process. Some countries are way ahead, I believe in Scandinavia and other places, but certainly for us in Malaysia, we are trying to follow that trajectory now and really bringing those aspects into our healthcare.
Yep. Minister Donnelly, what do you make of population health and data gathering? And
I think it's one of the most interesting regulatory challenges we have in healthcare. On the one hand, the advances in precision medicine are extraordinary, and we'll be in a situation soon enough where if you walk into a hospital, they'll be able to do a pinprick on your finger, and then they'll be able to give you tailored drugs to your own DNA, right? And the benefits will be absolutely incredible. The problem is they'll also therefore they will be able to predict to a very, very high degree of accuracy what's likely to happen to you in your life. And so I think there's a regulatory challenge here, which is to create the space and the freedom for innovation for the public good, whilst not allowing governments or companies to use that information to discriminate, which they could, and in some cases already do, in terms of genetic profiling, and so forth. So it's a fascinating and exciting area with a potential dystopian implication that I think governments are really going to have to regulate very closely.
It's going to be interesting to see how it unfolds over the next few years. Now, as we come to the near to the end of the session, I wanted to talk a little bit about another area of healthcare which is on the rise. A lot of healthcare companies, governments are championing the cause of prevention is better than the cure. So working together to prevent disease as opposed to waiting until it comes and then curing it. So Maria, looking at further methods and implementations, and the key being prevention better than the cure, I'm curious to know, what, in your opinion, can businesses do to incentivize better healthcare? So, for example, we've heard about better maternity leave, paternity leave, flexible working hours, weight management programs, bicycle incentives, stress management, mental health workshops, for example. What else do you think we need to see more of? What can companies here learn, or what ideas can you share that we can use?
I think that actually there are a plethora of options already on the table, right? And as you mentioned, flexible work arrangement and also multiple programs in place. I think that what we need to see more of is the adoption and that education on why it's important to actually follow some of those principles when it comes to mental health and also to physical health in general. And I think that when it comes to education, making sure that we demystify, in example, stress and anxiety at work is one of the key things that I think that are super important in order to unleash the real potential of people and to make sure that we get those tools and coping mechanisms in order to really thrive at work and at life, no? Yep. Education is key. I think that also we need to see, as I mentioned before, more of role modeling as well. And I think that we need to see more of that bottom-up engagement, okay? Because sometimes We try to instill things from the top, and actually we can see that the real movement and the real change happens when you involve people from the bottom and give the people the flexibility to own what they want to do, to express what matters to them when it comes to driving the perfect world being set up, and then empower them to actually deliver that.
Yeah. Yunus, what's your views on incentivization, and what should we be seeing more of in businesses?
Thanks, Rachel. Incentivizing is very important. Education regarding like these well-being, hygiene-related topics, that's very important. But I think there's like this kind of division between active and passive arrangement that I don't want to be cynical, but people tend to not to have very good memory over generations. So all kinds of like technological innovations and systems that we can create that are going to sustain and promote well-being and hygiene and these kind of topics, those are for good. And that's something we should consider. But they need to be really like integrated to the system level, how companies are operating and how is the culture structured so that we can actually apply all those best practices into our daily life.
Yeah.
So there needs to be some kind of integration between the idea and the cultural system. Otherwise, it's not going to happen in the future.
Well, there's lots of food for thought there and insights from both government and private and whatnot. Just to kind of wrap up the session on a somewhat of a lighter note, I'm going to ask you just an imaginary question, just like your answer, all of you, as a conclusion. So if you were the CEO of the best successful company, the most exciting company in the world tomorrow, what benefits would you introduce into your own workplace? And I'm going to give you some quirky examples. This is listed online. So for example, some people wanting on-site health clinic days, in-house banking services, in-house dry cleaning services, offering time off for fitness, on-site emergency daycare. So if you were the CEO of your own company, what is the one, let's say, unique measure that you would introduce? So I'll come to you first, Minister Donnelly.
Well, thanks very much. God, I don't know.
Actually, may I just say, will it be the water feature in the Saudi pavilion? Because I believe you said your kids would have loved that.
The magic floor in the Saudi pavilion is fantastic, yes. A magic floor at work would be fantastic. I'm a great believer in nutrition. So I think if there was one thing in an organization that you could bring in that really helped, it would be just super tasty, super healthy food. Moving away from the processed foods, all of that in the schools, in the workplaces. I think as a very simple thing that can actually be done, I think the potential benefit of super nutritious, sustainable foods would be enormous.
Yeah. That sounds like a good idea, and Irish cuisine is great, so yeah, you're on the right. You should start introducing that anyway from now on. Yep, and so Dr. Jamila, if you were the CEO of your fantastic company, what would be the thing you would introduce?
Well, I think not very different from what His Excellency said, really growing your own food in your own organization and being able to eat a healthy food and also build a culture that is away from meat and much more healthy, vegetarian, kind of diets.
Yeah. Yunus, is it nutrition that you would be introducing?
I'm actually choosing that it's usually like divided into nutrition and then being active. So I'm going the other route in this one, and I'm not even hiding that I have an interest in this one. But one thing that we have been thinking with Isku when we are comparing Finland to the Middle East region for example, are the height adjustable tables. So all kinds of like measures of being active during work day and stand up from your office desks, those are for good. And I think this is a transition that's going to happen anyway in the Middle East as well. So I think there's an idea to introduce as a benefit that if you want, you could have like this possibility to have all kinds of equipment to make you move more during your work day. And we are actually usually saying that sitting kills. And unfortunately, that's true. It's causing a lot of problems. And I think one of the biggest reasons for being absent from work in Finland, for example, is all kinds of pains and issues related to your back and your joints. So there's a good reasoning for being active during your work day. And this should be a benefit.
Thanks, Eunice. And you'll be pleased to know we have a break next, so everybody will be standing up and get some exercise. And last but not least, Maria, what would be in your imaginary company?
So I guess that if I was a CEO, I would focus more on keep driving a culture of freedom, okay? And maybe it's not a benefit, but actually a mindset. And is how we would really drive the freedom of choices of how you work on, or how you balance your day and your life, and freedom of choices of what benefits are the ones that matter to you. So I guess that is more aspirational, but one of the things that really are close to my heart.
Yeah, that's lovely. I'm joining all your companies, so nutrition, exercise, and freedom of choice. That's amazing. So that concludes this session, and I'd like, once we go for a break, I'd like you actually to get to know each other and actually exchange ideas as to what you would like to see in your own workplace. Maybe get some ideas going. Maybe you might introduce something after this forum. Who knows? But before we go, please join me in saying thank you for being here. First of all, His Excellency Stephen Donnelly, Minister of Health for Ireland. Thank you also goes to Maria Fernanda Paes Silva, who's the R&D Hygiene Operations Director for Africa, Middle East, ASEAN, and Greater China at Reckitt. Love the enthusiasm from the clapping, that was early on. Thank you. And also via live link, we have Dr. Jamila Mahmood, who's the Special Advisor to the Prime Minister of Malaysia on Public Health, but I believe that's been changed as you corrected me, I apologize. And we have Eunice Wikström, who's the Head of ISKU Middle East for ISKU. Thank you for joining us. And of course, last but not least, you guys, thank you for joining us. Right now we have a coffee break, which is on to my right, which is your left, I believe, or actually at the back. It's nearby. Like I said, please get together, have a chat, enjoy a refreshment, and chat and see how you can improve your own business or own well-being. And remember to take care of your health and each other. So thank you for being here. Thank you.
Ladies and gentlemen, please take your seats. The session will begin in 10 minutes. Ladies and gentlemen, please take your seats. The session will begin in 5 minutes. Our program will start shortly. Please make your way to the plenary. Ladies and gentlemen, please take your seats. The session will begin in 1 minute.
Welcome back. I'm happy you're all here. I hope you had a good coffee break. Hope you had some time to network and talk about all of the great discussions and the information that we had this morning. And it has been a very busy, engaging, indeed a very informative morning as well here at the Dubai Chamber's Health and Wellness Forum. So we're absolutely delighted that you're with us for the day. It's been great really to hear from leaders of industry, from government officials, and indeed from experts in health and wellness. We talked about the importance of partnerships and how we can all play a role in the health and well-being of our country, of our companies. Indeed, you know, we look even wider to that. We also examined the success of Dubai and the UAE to actually launch Expo and the efforts to put that on, and the work that went on very much behind the scenes with the health departments, with the big pharmas, with all of the departments to make sure that that actually happened. And we also discussed just now how the pandemic has really changed our lives, particularly when it comes to how we work and the different culture perhaps that's needed in the workplace. All of this so important when we look at a more holistic view on health and wellness. For the remainder of the day, we are going to share some case studies with you shortly, some very new and creative, innovative ideas that will actually hopefully inspire you. And we're going to hear from some great people that we have here and some that will join us virtually. We're also going to take an in-depth look at technology, of course, in terms of how it's impacting healthcare and how digitalization is really the big game changer. But our next panel, I'm very excited, I'm going to moderate, will be looking at medical tourism, health and medical tourism, and really looking at some of the leading hubs for medical tourism. I have two members on my panel here. Let me first invite the head of medical tourism based here in the GCC for Switzerland. So Joya Valli joins me. So Joya and I will be on stage for this. Joya, it's great to have you. And so thank you for being with us. So we're going to be taking a look at what's going on in Switzerland. And then we're also going to be getting a view from India. And I'm absolutely delighted that we have with us virtually the managing director from Sri Sri Tatva, Arvind Varchasby. Arvind is, here he is. He is in the house. Namaste. So it's so lovely to have both of them here with us. So we'll have a bit of a different viewpoint. So lovely to have you both, as I said here. Joya, if I can perhaps start with you when we look at medical tourism. And, you know, we look at particularly Swiss healthcare, I think famous around the world without a doubt here. But also let's just look at what's the value of medical tourism. I just saw recently a market analysis report putting the value at something like more than $54 billion. And this is a lot of money. Yes, I mean, we know the healthcare industry is very important to us all, but this basically means people jumping ship in one country and heading off to the Alps, heading off to Switzerland, heading off for medical tourism. So tell us just a little bit about its value to the country and how important it has been.
Thank you, Edna. Yes, I mean, that's the ideal situation, that they're heading off and jumping to the Swiss Alps. You know, Switzerland has always been a popular destination for medical tourism. It started already in the 19th century when we had patients for the treatment of tuberculosis who ended up in our Swiss Alps for the fresh air. But recently what we have been noticing is that there is a demand, or that there is a motivation and inclination from our Swiss clinics, the private partners, who are interested in expanding more and adapting their offering to the international patients. So that definitely has played a role in shaping the medical tourism industry in Switzerland.
And we'll talk a bit more about, we'll talk a lot about that in it. Let me, Arvind, come to you, because there's maybe not equally as many, but there's a lot of people also heading to India. And again, very, very different focus in terms of what's in India and what you're doing at Sri Sri Tatva particularly. Talk to me about the value of medical tourism, you know, for the Indian economy, because it is so important, and I think we're seeing it becoming more popular when we look at Ayurveda and we look at natural health.
Thank you very much, Edna. It's a pleasure to be here with all of you here at the Dubai Expo. First of all, I would like to wish all of you the very best of health during these very tough times that what all of us are passing through. Coming to your question, Edna, the Indian wellness industry today is estimated at around 49,000 crore Indian rupees. That would be estimated somewhere around $6.7 billion US, and it's also gaining momentum. What's really wonderful is that it's also backed by the government. The government has set aside a separate ministry that takes care of this entire wellness industry and the Ayush products and services market. Ayurveda per se has been witnessing a resurgence in India and also across the world, and especially during the pandemic time. We've seen that, especially here in India, a whole lot of clinical trials that have happened for management of mild to moderate COVID-19 cases. When you look at the CTRI, where it's the repository of all the clinical trials that happened here in the country, more than 50% of them are from the Ayush industry. What does this really talk? People are really coming back to the roots and also seeing that what are the solutions that are there in the Ayush industry and also in the products and services. I'm also happy to note that the government of India has also set aside a budget of 3,400 crore that's estimated at around, say, US dollars 464.68 million for the next 5 years to see that how Ayush wellness centers can be set across on behalf of the National Ayush Mission. We've seen that the center has also contributed towards the wellness sector by revamping more than 1.5 lakh, that's about more than 150,000 health centers across the country here in India. Wow. And so I think that this particular industry is here to stay and is going to get across more relevant in time. People are looking at more natural ways to maintain their health, attend to their health.
Absolutely, and I think it's great the country has really seen that value. I think they've always seen it, but as you say, they're really, looking at what the trends are now, and if there is a trend, it probably is more towards natural-based medicines. Joya, let me come back to you, because you're actually a dedicated rep based in the region.
Exactly.
Pretty much looking for business to bring us all to Switzerland. Now, this was not always how it was done, so this has been really a strategic move on behalf of the Swiss tourism to actually make sure that you're being more proactive in terms of, getting more people to come. Talk to us a little bit about the importance of that and why that's happened.
Absolutely. So Switzerland Tourism actually just recently has partnered up with our Swiss clinics and Swiss private clinic partners. That has happened just shortly before the pandemic. So we've only, I would say, for the past 1.5 years have been very active in providing platforms for our partners in Switzerland here in the GCC region to meet government, but also end consumers, potential patients, to connect those two parties together. So this has been a very bold move, but also a move that makes sense because Switzerland Tourism has been in this market, and not just this market, we have 24 offices around the world. So we are considered local experts, I would say. And this knowledge is here, and we help our partners in Switzerland to understand the market, to adapt their offering to what the market needs. And I think that's a great marriage, I would say. And it makes sense for Switzerland Tourism as well because it adds value to us. It adds a component that wasn't there before because we've only, in a way, promoted tourism to Switzerland from a leisure perspective, but actually there's a huge potential for health tourism as well.
Arvind, talk to us a little bit about the clients that are coming to India. First of all, like where are they coming from? And what ailments do I need to have that I might show up at Sri Sri Tattva and you could take care of me and send me home a better person, so to speak?
Thank you for that question, Etna. So I'm happy to invite all of you right away to our wellness center here and attending to your question is that you don't need to have a particular ailment per se to come and have an Ayurveda retreat or an Ayurveda therapy. So there are two things. One is that in terms of preventive healthcare and also in terms of curative. So the entire Ayush systems have both these two things integrated into the system to see that you're given what is really required for you at that time. What's really so wonderful about the Ayush systems, and especially Ayurveda, is that it's customized to every body type. So what really that would work for you would be different that would work, what would work for me. So there's no one size that would fit all. And the sort of clientele that we have visitors from over 156 countries coming into our wellness center. We do have, in case if I were to break it down as to from where do we have more tourism, we have a lot of tourism from the GCC, especially from Oman and also from the UAE, side, and also from US and also from the European region. So we really find that a whole lot of people are wanting to imbibe the lifestyle of Ayurveda, of seeing that how they could live a more healthy lifestyle. And one particular statistic that what I would also like to share with you here, Etna, is that research says that more than 45% of Indians born between the time of 1982 and 2000 aspire for a very good and healthy lifestyle, and also are a lot into fitness. What does this show? That people are just not wanting to attend to symptomatic sort of cures, but also wanting to attend to the root cause, saying that how can I actually improve my health? And that's where I feel Ayurveda is attracting a lot of tourism into India. And per se, from Trishi Tattva's side, what we've done is that we're not just limiting it out here to India, but also we've opened our centers across in the US. We have our wellness centers in Europe, at the Black Forest in Germany. We have our wellness centers in Oman, also in UAE. We also have our wellness centers in Canada as well, and also increasing our footprint. What does this show? That it's not only India, but the world really wants other solutions than just symptomatic cures. Thank you.
And again, that's a different strategy in that sense, because having a base in the UAE, having somewhere else in Oman, in America, that also, hopefully in one way gets people more interested, and then they want to go to India. So it's a very sort of, it's a nice positioning in terms of the marketing side of it. Talk to me, Joya, in terms of, again, what are the big treatments in Switzerland? And I think when we look back historically too, there are many that, there's probably a list of what are the key areas and why. Clearly we look at, I think, the specialty that India has in the Ayurveda. We look at Switzerland very differently in terms of specialty when it comes to surgeries, when it comes to, just give us a feel for why are people coming there, apart from the Swiss Alps.
Yes, that's a very good question. Well, I would say people who come to Switzerland, they are looking for medical expertise. Maybe also newest technologies, reliable doctors. And we have, I guess there is, in a way, guests from both spectrums, but I would say our main international patient would be someone who has a rather severe case, It could be an oncology treatment that they're looking to do. It could be also an orthopedic surgery, cardiac surgery, open heart surgery, and so on. That's of course not all. We also have patients that are coming into Switzerland for preventative treatments, and we see definitely an increase in that, because people are more aware about their health, and they are more, people can read. Everyone is Dr. Google, although our medical experts don't like that, but everyone knows about what's going on, and they would like to have a second opinion, even though it might not be a severe case. So I think why Switzerland, besides the medical expertise and the high standard, I think people are really, people can get a Botox injection in Dubai or everywhere in the world. They can get slimming or they can go anywhere for a detox. But I think what we are looking into now is slowing down and connecting again, and connecting with our mind and body. And I think this is really what Switzerland offers. It's this holistic approach. It's not just getting your injection done over your lunch break, although it's advertised as that in many places. It's about reconnecting and slowing down in a very fast-paced world.
And do you also find, when you think about it, it's, maybe clients from this part of the world might go there in the summertime when they've a bit of a break here, when the weather is possibly a little too hot to us. It's probably, we're seeing a lot more people coming to the mountains and enjoying, and it's not just the mountains, it's the cities as well. Absolutely. And it's the lakes and all of that. So I suppose there is that holistic look at it. But do you also find that if people go to Switzerland for medical tourism, perhaps, does that expand then to wider tourism?
Yeah, so it's vice versa, I would say. It's people who are coming for tourism, leisure tourism and who might then do checkups on the spot, or they would have, let's say, a slip disc. It's been there since years and they just couldn't fix it. And then they would approach clinics or me or someone to help them find a specialist, a spine specialist, for example. So it's really both. On the other hand, if people are coming for medical treatment, they usually tend to stay longer. They, especially if we're talking about the GCC patient, the average GCC patient, if you want to call it like this, they would not come alone. They would be accompanied with family and loved ones or for friends to support them along or throughout the process of the treatment. So our responsibility is to not only cater to the patient, but also to be able to offer to the loved ones that are accompanying the patient. So, yeah,
definitely. I can see where both could work very well. Arvind, again, I mean, there's definitely, you know, there's been a big interest in Indian traditional medicine, I think, for a long, long time. And it might have been seen as alternative. It's probably becoming a bit more mainstream now. But again, there definitely is a trend towards, I would say, probably more natural medicine. Now, even one of the formulas that you have, Kabasura Kudinir, I think I might have got that, something that will balance immunity, energy, and also has undergone, you know, clinical trials in terms of, you know, helping build immunity for the pandemic. So has this also been something where people, you know, are looking at the work that you do and wanting to be part of this and looking for this type of prescription?
No, definitely, Etna. If you see during the pandemic, a whole lot of people have turned towards Ayurveda and also traditional systems of medicine. One thing that what you mentioned here right now is something that really resonates very well with me, is that Ayurveda is not, or the Ayush systems are not perceived as an alternative system anymore, but it's another system of medicine. I feel that you know, consumer is king, and the customer decides as to which system of medicine would they like to imbibe in their lives. So when it comes to you know, lifestyle disorders, you know, Ayurveda is king. But when it comes to accidental care and critical care, there's nothing to beat allopathy that way. So I think that going forward, we definitely need to synergize and take both systems of medicine together and see that how this really and work across. One thing that what, you know, Zoe also said over here is something that what I also agree upon is that people are really looking at ways, particularly naturally, to see that how they could attend to their health. One data point that what I could give across to you here, Etna, is that during the pandemic, Gurudev Sri Sri Ravi Shankar, who's also the inspiration behind the brand of Sri Sri Tattva, the meditations that what he conducted during the pandemic was the most searched word in Google throughout the pandemic. What does this really show is that people are really wanting to attend to mental health as well. And that's where yoga, which forms a major part of the Ayush systems, play a great role in terms of how one can attend to one's own well-being and also mental health. Health is not only about the body, saying that, okay, do I have an ailment in the body? All right, let me set that right. A whole lot of it is psychosomatic. We need to also take care of mental health in this entire aspect of you know, well-being and wellness. And that's where Ayurveda and the entire Ayush systems bring this holistic approach to see that how one can attend to one's health both physically and mentally. And also, one other thing that what I would like to mention is that during the pandemic, Sri Sri Tattva has been tirelessly conducting clinical trials in India and also more tests abroad. We also have a tie-up with the Frankfurt Innovation Center for Biotechnology, where we have an MOU to see that how we sent Sri Sri Tattva's Kabasura Kudinir to see that on an in vitro level, that where it actually inhibited the SARS-CoV-2 strain on an in vitro scale at more than 86%. And we continued our clinical trials here in India, and we got our medicine of Sri Sri Tattva's Kabasura Kudinir repurposed as a medicine for managing mild to moderate COVID-19 cases here in the country. We didn't stop at that. We continued with more clinical trials, and at present, we have more than 10 different clinical trials that we are conducting on one of our proprietary formulations for managing mild to moderate COVID-19 cases, and which we would also be sharing across with the world very soon. What does this also suggest? It suggests that there's a whole lot of interest in both products and services of the entire Ayush industry. And this is something that's what's here to stay. And also from Srishi Tattva's side, we leave no stone unturned to ensure that we give the best of quality products. We are perhaps only the first to have the ANMAT GMP, which is in line with the PICS GMP certification for all our products, including the Srishi Tattva's Kavasaraputinir for COVID-19. And apart from that, we also have our facilities which are WHO CGMP certified, which not many brands have. So what does this show? It shows our commitment to see that we'd like to bring this 5,000-year-old science, which is still very relevant today with modern technology, to see that how it could be palatable to today's day and today's lifestyle. Going one step ahead, we also see that we've put in a whole lot of technology, whether it's the ERP solutions with regards to SAP S/4HANA, or also bringing in a whole lot of technology where we also have the aspect of online consultations right now, which is really very, very relevant during the pandemic. People cannot go out of their homes, but a whole lot of our doctors were there to not only console people mentally, but also give them respite with medical treatment and also with medicines as well.
And I think that is so important, that connectivity and how technology can play a role there. Joya, I suppose two things here following on in terms of, technology and how it has changed this. But just as, we might head off to India for a yoga retreat, and again, this is about health and wellness. We might then decide perhaps in the summer we go off for hiking around the Swiss Alps or whatever. So for me, it would be almost yoga style because it would be very slow hike, I would think. But, are there trends that we're seeing in the industry, when it comes to health tourism?
Oh, if you define a trend that is something that is coming and going, I would say no.
Right, okay.
Right, because I think Switzerland stands for quality, for tradition, for medical expertise, and this is not related to trends. And I think that's something that you might find in other destinations more than in Switzerland. And if you're looking for that, then that's absolutely fine. But I think Switzerland doesn't necessarily follow a trend because we kind of have to stick to that promise, right? However, as I mentioned before, I think when it comes to less invasive surgeries or treatments in general and less severe cases, we do see that people are coming to really relax and take a break from their life. So I think the busier it gets and the more, and I think this goes in line with my colleague in India said, we get caught up and we need to reconnect. And I think this is why Switzerland choose maybe, why patients choose Switzerland over another destination, because they have this expectation of privacy, integrity, nature, space, fresh air, and so on. So I think besides the expectation of medical expertise, these are the expectations that come along with, and it's beautiful when it can be combined.
It's true indeed. Arvind, we're coming close to the end of this, so I'm almost giving you a final question and a little wrap up all in one here. There's a lot of competition out there when it comes to medical tourism. Right now, I could probably put a pin anywhere in the world, in any country, and there would be somebody there, luring me in with great promises of rejuvenation and medical tourism, even if I'm just feeling a bit under the weather and don't have a major ailment. How do we overcome those challenges? And again, what's special about India to make sure that we're heading your direction?
Well, thank you so much, Etna. Just to let you know that in any sector, there should always be healthy competition. It also ensures that there's good quality and quality is maintained. So when it comes to the aspect of the wellness industry, I feel that this is something that what people have discovered right now, especially over the last decade. We've seen that a whole lot of interest has been generated in the aspect of yoga and also in meditation and also in terms of Ayurveda. How Srishi Tattva is really looking at it is that we'd like to contribute to medical tourism in every country possible, and that's something that what we would like to do, and that's where we have this hub and spoke model whereby we do have certain treatments that what we offer in our satellite centers abroad, but to have a complete holistic retreat, that's something that what we invite people to come here to India. And also one more thing that what I would like to also say to my fellow panelist over here, Joa, is that we would be happy to see that in case if there are any synergies that what we could do there in Switzerland, to also bring across the aspect of Indian wellness centers over there in Switzerland, and also see that they're also given their recognition. Yes. This is something that what we would also like to strive towards, and see that how it's not only bringing in people here to India as health tourism, but also export the aspect of services that what India has to offer in the health industry sector, and also especially in the wellness center to countries abroad as well.
Thank you so much.
Coming back, yes, just my final word on this is that the health and wellness industry is something that's here to stay, and is going to be very relevant with regards to how consumers are turning more towards natural remedies.
Indeed, yes, and I do think, you know, when we look at health and wellness together, and we look at physical and mental health, it is about that combination that's, you know, people are looking for something that can be a bit more holistic, and without a doubt, I mean, I think we look to a lot of some of, you know, the great value coming from India. Closing off with, again, Switzerland, you know, a few challenges that might need to be overcome to make sure that more people are going to come and enjoy you know, health tourism as well as just a wider tourism there too.
Right. In general, I would say it's our partners' responsibility, and by partners I mean our clinics' responsibility, to really adopt their services to the specific markets. So I think you know, we have the big names in Switzerland that have been dealing with international patients since years, but what we've also been seeing is that smaller clinics that have a very bespoke approach and very private environment are in demand, and from their side they would like to tap into, for example, let's say the Gulf market. And I think the challenge there is that you really have to understand where your patient is coming from, what their cultural background is. It doesn't necessarily need to be, you know, a halal offering, but showing that you understand what they need. And I think this is definitely a challenge that that our partners are facing and working on. And I think we have experts in Switzerland, they have us here to support them along the way. So this is something. And then, I mean, another challenge that we are facing is the pandemic. Of course, we without doubt, we can say we've all been hit by that. We cannot leave that, you know, out of the picture. But I think Switzerland, similarly to the UAE, has had a very pragmatic approach to handling the pandemic or you know, the COVID policies. So I would say that's something that, and we could only do that because we had a very well-established healthcare system. So I think, you know, but it is a two-way street. If we look at the UAE, we had 20% more visitors in 2020, in summer 2020. Sorry, 2021. No, 2020, yes, compared to 2019.
Right.
So we had more visitors than pre-pandemic. And that just shows that I believe, you know, tourists, whether it's for medical tourism or leisure tourism, they really look at going to places where, besides aspects like space and privacy and fresh air and, you know, not overcrowded places, I think they do look at destinations where they know in case if something happens, they are in good hands. And I think
absolutely. Really, I mean, I think there's, you know, there's so much choice out there, but also I think we look at this industry, you know, yes, it can do a lot for us, for our well-being, but it is without a doubt a billion-dollar industry. It's growing. I think people's awareness, and also people looking after physical and mental health, and where they can go to a different country, you know, breathe different air for a while, get a different experience. I think all of that is certainly something we're going to see more of in the future. So good luck to India, good luck to Switzerland, to all of the great locations we have to choose from.
Thank you.
And indeed to, you know, the growth too of health tourism here in the UAE. We're seeing that, so we can manage to do a little bit of it all. So Arvind from Sri Tatva, thank you so much for joining us from Bangalore. It's lovely to see you. Thank you. and to
it was a pleasure
Joya
to be here.
Valley, who's joined us here.
Thank you
so
so
thank
much,
you
Ed.
so much. Now we'll just go for a short video just to clear, and when we come back in just a minute, we're going to be looking at digital transformations in healthcare, and of course looking at that through new technology. So we've heard that touched on a little bit this morning, so it's very, very exciting. We're going to go really in depth and have a look at just what is happening when it comes to digitalization of healthcare. And our moderator for that session is Piret Hivre from Estonia, and he's going to be with us very shortly. Thank you.
Good afternoon, everyone, and welcome to the session where we are going to talk about new technologies and opportunities in the health and care that these new technologies bring to us. My name is Piret Hirv, and I'm really happy and proud to present Estonia here, one of the most innovative and vibrant digital societies in the world. We do have health record, digital health record for every single citizen in Estonia for more than 15 years now. We do use different digital solutions for the health and care to provide the best quality approach to our citizens. And that's why this topic is really close to my heart. Personally, I'm a nurse, but my everyday job is to support innovation in the health and care sector, to support startups and bigger enterprises to bring innovation to the real life, because innovation happens only when it's in use in real life, those new technologies. I'm the manager of Connected Health Cluster, and this is a job what I do every day. But the topic is really fascinating, relevant, and I would like to introduce my panelists of today. So first I will invite Kusai Al-Momani to the stage. And Kusai is a Chief Futurist Officer of Vita Vitamins, and he's from United Arab Emirates. Welcome. The second panelist is from Spain, and Carlos Albarracin is Business Development Manager, Healthcare Indra, and from Spain. Third panelist is from Portugal, Joaquim Cunha, and he's Executive Director of Health Cluster in Portugal. Welcome. And last but not least, Fei Chen, General Manager of Middle East and Egypt United Imagining Healthcare. Welcome to the stage. Thank you, gentlemen, for joining this session today. So, we all know that there is a pressing need and also an opportunity, of course, for health to be more efficient, to run healthcare reforms, and for sure we need to achieve better results in our healthcare delivery. Efficiency and quality are also key elements in nowadays healthcare. And it's really important to streamline physicians' work and make it easier, because the burden is really high, as we also heard from the previous sessions, that healthcare workers are under pressure nowadays. And we definitely need to improve patient outcomes, for sure. So, and for that, we have brilliant guys and girls who are developing new technologies all over the world. But first, before to start this discussion, I would love to hear more about you, your personal drive, why you are in this field, and what do you think what is the biggest obstacle or barrier in transforming healthcare to more innovative and to better, for better outcomes. So let's start with you.
Well, first of all, thank you so much for having all of us here today. Hi, everyone. My name is Gusay El-Momeni, and I'm the CFO of Vida Vitamins and Managing Director and CEO of 8 diversified companies in UAE. Our key focus is distribution, and we have Vida Vitamins today, which is an emerging digital pharmaceutical company, winner of the most innovative healthcare solution as well of the year. My passion is 2 things. A, it's enhancing the skill set in UAE, bringing talent from young men and women from the United Arab Emirates to promote the presence of UAE nationals in the pharmaceutical sector. B, technology and digitalization, and how to use that technology to tackle some of the unfair practices in the pharmaceutical sector nowadays, especially when it comes to margins and unfair margins on customers. So we believe in 2 things: enhancing the skill set of our country and empowering the customer. Thank you.
Thank you. Carlos.
Yes, thank you so much for having us here. My name is Carlos Albarracin. I'm from Senior Manager at Minsight, which is part of a leading technology and consulting company called Indra. We are based in Spain, but we have office branches in many countries, and we operate in diverse markets such as banking, industry, telco, and of course, healthcare. I like what I do because the first project that I participated in my professional life was development and deployment of a clinical information system for nephrology. With that project, we contributed to reduce cost by avoiding duplicate tests, diagnostic tests for the patients, and other inefficiencies that were caused by the lack of integrated information among the different centers that participated in the patient's treatment. Since then, and 25 years after, I've always been involved in the development and deployment of clinical information systems. And in my opinion, the main problem is the difficulty to implement a universal electronic medical record, which would be the key achievement to accomplish many other objectives, all of them related with data-driven healthcare. The multitude of different information sources that are part of the healthcare ecosystem, from organizations on systems to personal mobile devices, result in huge volumes of unstandardized and unstructured data. And this leads to fragmented health records, okay? And this, in addition to the fact that health data is sensitive information ruled by strong security and privacy policies, makes this information very difficult to be shared across networks. So one of the main challenges in the healthcare industry right now would be to implement healthcare information exchange mechanisms that would allow us to collect all this data generated by the healthcare organizations and process it so that it can be used by the healthcare professionals in the decision-making process.
Thank you, Carlos. Joaquim.
Thank you. It's a very nice pleasure to be here. I thank you very much, the organization, for the invitation. My name is Joaquim Cunha. I'm CEO of the Health Cluster Portugal. We are more than 220 institutions comprising what we could call the health value chain, from the universities to the companies, involving also the hospitals. We are targeting the health as a whole, and our concern is to improving the ecosystem, the knowledge valorization, finding answers to the challenges that in this area we are facing and we have to face in the future. Why is this close to my heart? Because I would like, although with a very humble contribution, to be part and contribute to the revolution in progress that one could name as the health of the future, the new health. I do believe in this. We are now in the beginning of a new era. The health that we will have in 10 years from now, it's completely different from the health we have now. Some problems, some key problems that we have to face. First one, I would say the need, which I fully support, to follow the ethics fundamentals with a consequent regulatory burden. Perhaps sometimes we are going too far, and with the pandemic we saw that sometimes we could go faster. Another one is the difficulty to integrate a huge number of different and complex systems and technologies. But we are here to solve them. Thank you.
Thank you. Fei Chen.
Yes, hello. Hello, everyone. It's my pleasure to be here today with all the speakers, and it's a very precious opportunity to introduce, to discuss about the digital transformation. My name is Fei Chen. I'm the GM of United Imaging Healthcare in Dubai. I'm the GM of the Middle East operation. Actually, our office is located in Dubai right now. The companies originate from China. We are a developer and a solution provider of diagnostic imaging and also artificial intelligence, intelligent variables, and with advanced technologies. So speaking of today's, this is a general introduction on myself. I'm also working in the Middle East for more than 15 years. For today's subject of digital transformation, I believe the major barrier would be considered as the infrastructure, the hardware and the software. And to consider to change from the paper form of data to the digital form of data, so it takes a lot of efforts from the whole industry and the ecosystem. And from my experience that with my company's R&D and special focus and develop in the artificial intelligence, we are applying the big data and deep learning, not only with the data from the patients from China, but also United Imaging now is a global company, even though it's a young company. We are collecting the data from all of our premises, our operations, images, and patient data from the world to build up the artificial intelligence server and the big data database to be able to support the quality assurance in the diagnostic imaging field. For example, we talk about the image quality assurance plus the report quality assurance, and plus during the pandemic, our company is developing it since the pandemic initiated from China. So we collect the patient data from the very beginning of the pandemic. So we managed to develop the artificial intelligence for the pneumonia and lung scan to support the radiologists and the doctors and the hospitals to make a quantitative comparison of the normal pneumonia and the COVID-19. So I believe all of these efforts with artificial intelligence and deep learning is a very important driving force for the digital transformation. Thank you very much, briefly. Yeah.
Thank you. So, yeah, we heard about artificial intelligence and transforming care delivery and improving patient experience and telemedicine, artificial intelligence, blockchain, electronic, whatever, health records, but to make it all happen, we need to have digitalized healthcare, and this is the key enabler. So now I would like to challenge you a bit, and let's fix the world at once. So what are the driving forces for digital transformation? Let's start with you, Kushai.
Well, I think the driving forces are mainly the need for it. We've all experienced the world last year and pretty much now with a lot of our daily lives being limited. So it comes from a need to create ways for us to access things without having to meet in person or, for example, travel somewhere. The second element is obviously cost. So cost is a big issue. It's not necessarily that digitalization makes everything cheaper, in my own opinion, because I've experienced it in several companies I got involved with. But it does make it possible to empower the customer a little bit, to provide the customer with a better experience and definitely better prices. Maybe not so much for the company itself. And obviously the biggest, in my opinion, and this is something we're very proud of having here in UAE, is the government, the legislator. The legislator here is, almost a step forward in front of companies. So before we think of something, usually the Ministry of Health or DHA is already one step ahead. This is something to appreciate because we don't feel like, when we talk about digital and AI, and we do this quite often at VIDA because, we have this quiz and we have like a data hub and there's a way in which we profile customers. We don't feel like we're talking with deaf ears when we're dealing with, the governmental side here. So I think it's very important to have a successful example like we have here in UAE, where there is a boost from the legislator to promote such businesses.
Thank you. That's very relevant points. Joachim, what about, in your opinion, who is responsible of releasing all this power? And if you think about the ecosystem point of view and the support to the innovation in overall.
It's always difficult to answer this kind of questions, but I'd say first, I think we need a strong will from the top. The leaders have to definitely define this as a strategic bet to change what I called before the health for the new health, and the way to do it is basically the use of the digitalization, the use of the power of the data, the use of the new technologies. But at the same time, we need a support from the infrastructure. We need a technology the technology available to answer this. And this, of course, involves costs. This, of course, involves important budgets to do that. And another important aspect is the patient literacy. We need to have always a focus, an eye on this. And the last but not the least, all the human resources related to health, from doctors to nurses, from technicians. It has to be some kind of a wave. Everybody has to be involved and believe that this is something that leads to a change, an important change. We could later talk more about the change, but for the moment.
Mm-hmm. Okay. So thank you. Carlos, what is the key word here?
I agree with what they are saying clearly, but I also think that it's also a cultural change, this driving force. Today, people are seeking for more personalized healthcare, and through remote pathways, okay, to the professionals. And I mean, why visit the clinic to see your physician when you can video chat with them and even exchange clinical data online? So clearly technology is important, but it's also, again, what people are demanding. And from the doctor's side, technology can improve service delivery and treatment. Telehealth, for example, has been a key factor in managing the current global pandemic, where we had to maintain social distance, but at the same, we had to receive high-quality medical care.
Thank you, Carlos. So, Fei-Chen, you mentioned infrastructure as one really key element.
Yes,
but,
I just want to
yes.
Just want to complement what I just mentioned in my part of the discussion, also with the discussion of the speakers. I believe, yes, infrastructure, we are talking about not only because I'm a representative of the manufacturer side, the industry side. So actually this need a collaboration and joint force power, and as he mentioned, a very executive level of like a government level to push forward, because many of the hospitals, or say especially, for example, in my field, a radiologist, some of them are still not fully cooperative, or say a little bit reluctant in terms of the artificial intelligence and the new technologies. And they may think, okay, well, the artificial intelligence, this kind of new technology replace the radiologist. Actually, it's not. It's to support the workflow of the hospital, the radiology department, and the radiologist, and to help them. And for example, the junior radiologist or junior practitioner, a junior technician, they will benefit exactly from the artificial intelligence. So I'm saying from the personal angle or from the higher powers angle, that these we have to push forward for the new technology and the digital transformation with the ecosystem, the whole ecosystems, the whole link, every single point of the link, support and efforts. Then we can push this forward to the new level of this digital transformation. That's, I believe, this is the driving force for the industry and for this sector.
Thank you, Fei-Chen. You actually asked the question without even me asking this question.
Sorry.
No, it was exactly what I wanted to hear. So thank you. Thank you for this clarification. So, Carlos, you talked about data, and yes, data is a really important element of digitizing health and care sector. And we know that there is a potential in data, all sort of data with what we are collecting via wearables or what doctors are collecting. But still, it's my personal feeling, and I think that you can support me here, the full power of data is not released yet. So you touched this topic slightly, what should be done to have more input from data and from better results from using data?
Clearly what the healthcare industry has to the main challenge, I'd say, is the fragmentation of these, of the whole information that is gathered from multiple systems. So interoperability is key to solve these problems. And data has to be normalized, and it has to be based on standards so that it can be aggregated and used in the decision-making process. We can deploy in artificial intelligence and machine learning technologies, but first you need to have the data. And unless you have aggregated data, the machine learning and artificial intelligence technologies will only act on a small amount of what we can analyze. And so it is key to provide all this information to the different participants in the healthcare sector, providers, citizens, and once everyone has access to what I mentioned before, if we are able to achieve this universal electronic health record, then we would be able to achieve many other objectives related with health data management.
Kushai, what is your, yeah.
Look, I appreciate everything Carlos said here and everything else the other speakers mentioned. But I think, and a lot of people may disagree with me here, but I think one key challenge that we need to think about is the old mindset of leading doctors and healthcare professionals when it comes to advancing and digitalizing healthcare. You know, it's no wonder your dad usually asks you how to install an app. Even statistically, research shows us that, you know, as we progress with age, we tend to lose track with technological advancement. There needs to be involvement of the youth at a high level in the advancement and digitalization of healthcare. Without that, I don't think we'll be able to achieve the desired goal.
We don't argue against it at all. So
No, I'm not saying. No, I'm not saying that you know anyone would argue against it, but you would find it as you progress your way up. And I did see it myself, that there's often this, you know, old school of thought on the way we have done things. You see, medicine itself as a field has been developed, you know, all the way you go back to Andalusia, you know, the old Arabian time in Spain. We're talking about 7th century. They've established the basics of surgery and healthcare. And I feel like we're still stuck a little bit with old times. And yeah, please go ahead.
I was going to say that I agree completely. Governments have to be involved because processes have to be changed and new rules have to be written. But I agree completely with you that medical schools should participate, and students in those schools should be taught to lead the use of technology when they become physicians. It is key that that part of the population implements those changes. Not only, you don't leave this responsibility to the government, but it is the physician workforce that should implement these new ways of using technology for achieving a better healthcare.
Yeah, true. In Estonia, in our ecosystem, we do collaborate with the government, we do collaborate with the universities, with medical schools. But what about in your country, Joachim? How you push this collaboration between different stakeholders?
We have a say in our country. It is a glass full, half full or half empty. It depends on the way you look. In my perspective, I think we are in the good way. Because I agree what my colleagues of panel have said. We need to have a broad perspective. We cannot face these problems with isolated actions. Everybody has to be abroad. Not only the decision makers, but also the technicians, the doctors, and in the end, the patient, the citizen. And we I can bring to you an example of a project that is led by us, Health Cluster Portugal, that brings together hospitals, private and public hospitals, brings also analysis labs, 2 insurance companies, and what is the aim of this project? It's to create what we call a data lake. And this is important. This is the next step of the primary use of data. You have data that collecting every day from many devices, but if you mix this data and you could use the artificial intelligence and other tools, it's an amount of information that you could use, and this brings to the new health, the preventive health. You can forecast what will happen to each of us and to all of us, and this is the way. I think to finish, the key words are collaboration, cooperation, network, with a framework of strategic view.
Peichen?
Well, I think I've just mentioned a lot of points in my previous speech. Just to add, I think what we are all focusing on is this like a kind of a chain of collaboration here. So I think also previously we mentioned about this kind of a remote, the remote treatment, like the remote medical. All of this, it is related from the small to one person, and to, for example, to a family, or to a clinic, to a hospital, and bigger to the like it can be from a town, from a provincial center, or to a metropolitan. So, for example, some of we say the digital transformation or digitalization is to be able to transfer all the data. For example, starting from the intelligent wearables, the patient data will be transferred to the clinic. From clinic to the small hospital, maybe small hospital the medical staff cannot process, then go to the a higher level of hospital, then to the biggest hospital. And all of these players, as a chain, as a collaborator of the whole thing, they all should accept and focus and put efforts to this whole system. Then I believe this is the future we are talking about. Because now, because of the pandemic, actually, we just discussed this subject, everything is changed after the pandemic. There's a driving force pushing the healthcare system to make this adjustment, self-adjustment. Oh, just my extra comments. Thank you.
Thank you. So we have discussed here like how it should be in the future and what should be changed, and but who should take the action? Kusai, do you have an answer to this?
Like, I think I kind of touched on it previously. Like, obviously, the leader always of advancement is the entrepreneur. So the entrepreneur is the person, from the French word, they present the idea, they bring the idea, they create it from nothing. And I think that idea cannot grow if the facilitator, which is the government, the legislature, if they do not sponsor it, harvest it, and help that entrepreneur to reach their end goal. That I think is the main point. Obviously, there needs to be, like the business itself or the concept needs to make sense to people. So you gotta have a viable product. You gotta have something that you're actually selling. But without, it's like a two-way approach. You need to bring the bright ideas. They need to make sense, but the legislator needs to help you to support it. And unless you have both, I don't think it's possible to advance.
And from your previous statement, I also picked up that it's really good if the bright idea is developed together with a need. I call them like the people who actually know where the problem is, like really the end users of the product. So I guess then.
Yeah, like I noticed this when we started Vita Vitamins. For those of you who are interested, by the way, we set up Vita Vitamins as an LLC in April of, like, that was just after COVID. I mean, COVID was beginning in March. We set it up in April, And we managed to set up a company completely LLC without the need to go somewhere. So I'm talking about this level of advancement. We brought an idea, it was born in COVID, at a time when in most countries around the world, you couldn't even go outside your house to set up a company. So this is an example of facilitating by the government. Number two, I think a very important point to talk about. We thought about what is it that bothers every customer nowadays? Why are we all deficient of vitamins? Well, the straight answer is because nobody wants to carry like a bottle or 3 bottles of vitamin C, zinc, and L-carnitine or whatever to the gym or to work. So we thought about, smart new things, like we create a pouch and, the pouch has everything you need. When we tested it on the market, results were immediately successful. But I think had we not had that support, and obviously, all the incubators in UAE here were, extremely supportive from the very start. You name it, like we requested a meeting, they would help us in facilitating meetings, support in terms of anything, co-marketing, raising awareness. Like, we never had to ask twice. And I think that did help us to a huge extent into bringing us to the position that we're in today.
So, thank you. So we have a few minutes left, so who should take the action? We are, all 3 of us, we are from Europe, and we know how we struggle there with all this releasing the power of data. So who should take the action? Who should solve this?
Well, please let me, now that he talked about his product, please let me mention a project that Indra is carrying out in the Balearic Islands. We are deploying an healthcare information exchange. Our product is called One-Site Suite, One-Site Healthcare Suite. And it requires the implication of the government to state the requirements for what data has to be shared and how it's going to be communicated. It requires the implication of us, the providers of technology. And definitely it requires, and we sit with all of them, the involvement of the physicians, because we tailor the solution to their needs. At the end, it's them that introduce the data. Okay, so the tools have to be useful in their day-to-day activities. Otherwise, they won't use them.
Yeah,
so,
add value.
Yeah, so we implement the technology, we customize that technology for their needs, we satisfy the rulers, let's say, requirements, and of course we involve also the citizens, that at the end we as citizens are the ones that benefit most from the implementation of these technologies. So it requires the implication of all the actors that form part of the healthcare ecosystem.
So, Joachim, quick comment on that.
A quick comment. Yeah, of course, the action must be led by those who have the power to do that, and that are the decision makers. But we have to, for that action to occur, I think we need a strong civil society, which comprises ideally the patient, the citizens, but also the companies, also the health professionals. So we need, again, the top decisions to lead, but with an informed participation of the whole ecosystem.
Fei-Chen?
Yeah.
Really quick comment.
Last few seconds. So I think the top-down approach is a must, as all the speakers mentioned. This is a must, and with the legislative power and the government and efforts, but also from industry-wide, I believe that the bottom-up approach is also very important. We have to develop. We are the developer of these solutions. So we develop them, we promote them, we explain the benefit and how it supports the industry, and let the decision makers to understand and know, and then experience, and then by the end of the day, the medical industry is experiencing marketing. So we have to let them feel it, experience, and also this will support the decision making from the top, from the bottom to the top. Okay.
So thank you, gentlemen, for this very brief discussion into this really deep and important topic. But what are key words to take back home, for me at least? Collaboration, of course, this is what we know already. it's needs-based development of solutions. For sure, you have to be a user, or you have to have a user for your solutions in order to be innovative. And in my mind, also innovation only happens when it's implemented in real life. So for that, we need all these collaborative mechanisms in place to support companies. So thank you, gentlemen, for this discussion. And now we have next session starting shortly, opportunities for tomorrow. And I'm proud to present the video of the next session, and really thank you all the organizers for this amazing opportunity. Thank you.
The new normal, where we reimagined our offerings and reinvented our businesses. A world where change is the only constant, and where speed and cooperation have accelerated exponential thinking. Where the power to convene instantaneously and universally is reinforced by technology. Where collaboration is the foundation, and where ease of access and seamless connectivity are the norm. Where talent is recognized, achievement is celebrated, and business always has a seat at the table. Where success lies in our ability to look at the bigger picture. Where advancement is the only accepted mindset. And as we take a step forward, it's time to say, join us, make your mark. Welcome to the pioneers, the path definers, and the game changers amongst us. Welcome to a place where business as usual is anything but. Welcome to Dubai.
And a big thank you to Piret there from Estonia, and Piret and all of our panel there, really bringing us up to date in terms of what's happening with technology and digitalization. Fascinating discussion there, because I think there's so much more, even beyond our imagination, going on at the moment. And what we see happening is just really just the start. I think the capabilities are endless. We're now, just before lunch, going to have two wonderful speakers who are going to give us a bit of a case study presentation, because what we'd like to do is to feature some innovative creators who are out there, people who are doing things a little bit differently, and people who can add value to our lives. We're not going to have a discussion with them. They're just going to present their new innovative ideas, talk to us about what they're doing, talk to it about where the value that it does add, and then hopefully they'll be around at lunchtime if you want to catch up with them. And our first session is going to look at how mobile and temporary healthcare solutions solve capacity problems in a sustainable way. And I've been just absolutely fascinated with the chat that I just had in advance, talking about foldable containers, and that's all I'm going to leave you with, because we're absolutely delighted now to have with us the medical director from Continest, coming from Hungary, but with a big base here in the UAE, so he's not trying to import anything for us. They're eagerly working here. So a very, very big warm welcome to Christian Dalos. And he's coming to this side. Christian, welcome. I'm really fascinated to hear what you've got to say.
Thank you very much. Good afternoon, ladies and gentlemen. It's nice to be here in Dubai, in the Expo. As rightly said, my name is Christian Dalos. I'm representing Continest Technologies PLC. I'm a medical head of the company. Before that, I was among the founders of one of Hungary's private clinics. And before that, I was working in the financial sector. I'm originally an economist, but it's been 20 years since I've been in the medical sector. Today, I will present you a project that we have done together with the WHO in Africa. It's about how mobile temporary healthcare solutions solve capacity problems in a sustainable way. It's the name of the presentation. But before that, I would like to say a few words about our company. We are a container manufacturer company. We produce, design, and manufacture foldable containers, which means that we actually fold our containers to 1/5 of its original size. And with that, we are able to save 80% on the cost of transport, logistics, storage, and 80% less CO2 emissions. So the technology is quite advanced. It's an innovative solution based on a special hinge technology that helps us to fold the containers. And it's a sustainable way to, it's a new sustainable way to deploy containers in the medical field as well. Regarding sustainability, it's probably the most commonly used word in the Expo. If you walk into any of the pavilions, country pavilions in the Expo, you probably will find some kind of a sustainable solution, product, or whatever. And when we think about sustainability, we usually talk about the environmental aspects of sustainability. It's about recycling, more greenery, paperless environments, circular technologies, or circular economies, and so on. But we tend to not talk enough about sustaining our current systems. In the medical field, we are facing quite various challenges, from pandemics, which we are all experiencing in the last 2 years, and we haven't really found out our ways from this problem. There are refugee crises, immigration, there are human and natural disasters, wars, and so on. We have to find some kind of a solution for this when we talk about the medical industry. What can we do? Do we have answers for this? Obviously not. I don't think we do. I don't think what we would be able to do if another pandemic just pop out from tomorrow. There is no really answers for this. We are kind of just floating after the situations. So what can we do? We can apply different solutions, alternative solutions, innovative solutions, or we can just build more facilities. We can build more hospitals, we can build more examination rooms, we can buy more equipment, but we don't really do that. Most of the countries' healthcare systems are underfinanced. They lack of beds, hospital beds. There are waiting lines for examinations. So there's various problems basically in all countries. So what can we do? What is the solutions? Since most of these countries are not willing to pay more for their healthcare, we have to go and find alternative ways. And this is where our technology, or technologies like ours, could come in. And this is where we can deploy rapidly, and we can provide capacities very fast wherever it is needed. So the presentation I'm showing to you is a project that we have done in Africa, more precisely in Uganda. It was organized by the WHO. So it's a WHO project. It was initiated by them. It was financed by the Ministry of Trade and Foreign Affairs of Hungary, and it was coordinated by Continence Technologies and the local people in Uganda, the local WHO people. The problem was, or the original brief of the project was, that we need to provide some kind of a medical solution in Uganda, where the country is under a lot of pressure. I don't know how many of you know, but Uganda is the country in Central Eastern Africa where a lot of the refugees end up. It's a refugee hub. It's a refugee hotspot. And the country does not separate the refugees from the local people in terms of medical care. So the healthcare is under one umbrella. That, in mind with the pandemics and the refugees coming into the country, puts a lot of pressure on the country's healthcare system. So they needed some kind of a solution to ease on that pressure. And we came up with the idea to provide a multifunctional facility in Uganda, which can be very easily and rapidly deployed, put in place quite fast, dismantled quite fast, and use it in other areas in the country. The basic idea was a multifunctional emergency unit, which was, as you can see on the pictures, delivered in one truck. The facility is made out of 6 containers. 5 of them are opened together. One is a bit separated for serious cases, and it provides sort of an inpatient ward for emergency care. The whole system was deployed in basically 2 days from Mombasa to Soroti, which is in northeast of Kampala, the capital city. It's kind of like a hub for the region. It's the hospital where we deployed this system was called the Soroti Regional Referral Hospital. They are facing a lot of challenges. The situation there is quite bad. You see the COVID patients basically walking into the hospitals. The facilities are in very bad conditions. They're taking out 5-6 people every day from the hospital and dead, basically. So it's one of the spots where such technology is needed. So we managed to deploy this system, as I said, in 2 days from Mombasa, Kenya to Soroti with 1 truck. And we set up the facility, as you can see it on the picture, in 10 hours. So within 10 hours, with 5 people on the ground, 3 from our company and 2 from the local people, we set it up, we made it ready to go, and made it operational. Even the local people did not believe that it was possible. And if you see the photo on the middle down there, that was the original emergency unit. If you can see it here, that building. There was only 2 rooms there for 2 people. And then we created 10 beds for 10 people, plus 2 extra beds for emergency cases or more critical cases. So it was a really nice project. We have done it in a sustainable way. We managed to deploy the system with 80% less CO2 emissions, with 80% less costs, and with 80% less costs on storage. People could, of course, dismantle this system and take it to the other parts of the country. We taught the locals how to use the system. We gave them manuals, and they are ready to use it, and they're very happy to use it. The WHO, who was the organizer of this and who was the initiator, liked the project so much that they're actually sending a delegation to us early next month to talk further about such projects and similar projects, not just in Africa, also in Europe. We can use it for capacity enhancements and so on. So we are very happy that the WHO has such a progressive mindset, that they actually understand the idea of sustainability in mobile medical healthcare and in mobile technologies. So we are grateful for this project, and thanks WHO for this one. Also thanking for the Hungarian government for supporting and financing the project. And I am thanking you for your attention. You can see some photos of the handover, and these were the local people, so happy to be there. Thank you very much. Thank you for your attention. If you have any questions after the set, I can talk to you. Thank you.
And then we had Christian Dalos. Christenum, is that what I say, Christian? Christenum.
Christenum, yes.
There we go. My only little bit of Hungarian. I just thanked him. So again, fascinating there, and this is what we want to do with these little showcase segues just to give you a feel for some of the exciting and dynamic work that's going on there. And you can really see how the WHO, and indeed, you know, many areas, I can see its deployment in Africa, but gosh, it's, I love the foldable nature of it, that it's easy to transport. So well done, Christian, I wish you well. And I know they've been manufactured in Jebel Ali, which is absolutely exciting too, that we have a local ownership, so to speak. We're now going to be hearing from the General Manager of Medical Business Division from Fujifilm, from Japan, and he's going to be talking about a new concept of artificial intelligence driven screening and lifestyle centers in the healthcare industry. So once again, a very warm welcome for our next speaker to present Subin Uni. Subin is joining us. Let's give him a big Dubai welcome, an Expo welcome. Subin, lovely to see you. I'm looking forward to hear from you.
Okay, so good afternoon, salam alaikum, konnichiwa, and namaste. You know, so on behalf of Fujifilm, I would like to thank each and every one of you for coming and attending this session. And also I would like to thank the Expo 2020 organizing committee, you know, our Hakuhado Inc. company from Japan, Tokyo, for giving me the opportunity to present this topic. So what I would like to talk on the AI-driven healthcare, and why the AI-driven healthcare comes is, you know, majority of our near, you know, and dear ones, we have lost to two dreaded illness. One is, you know, the cancer, and the other one is, you know, the lifestyle cardiac disease. We have lost many of our near and dear ones. Why have we lost? Primarily because we detected this at a later stage, you know, at an advanced stage, where we had no hope of recovery. What we aim to do as Fujifilm with our technology innovation, with our artificial intelligence, is to detect this at an early stage. So we aim to bring this technology to save many lives by early detection. And this is what we would like to present in my presentation. So we bring these experiences with this new healthcare business division with our artificial intelligence support. So as you know, the screening program is very much present in Japan, which has one of the highest screening centers in the world, around 5,000 screening centers. And also in the Western world, there is a lot of this screening center culture. We aim to bring this into the emerging world, you know, where we would like to present our cutting technologies along with our clinical services partner. Why is early detection important? As you see in the screen, you know, the early detection, with the help of early detection, we have seen why in Japan, the life cycle stage is around more than 80 years. And why in the emerging world, it's around 60 plus, 69 around. We aim to bring with our technology, create and match countries like Japan, where we aim to expand you know, the life cycle stage of every citizen. How you can do it is through early detection. As you see from this slide, you know, when you detect at an early stage, you see the recovery is much, much higher. You know, when you detect it through the screening programs at an early stage, your recovery is almost 100%, 99%. Whereas if you go to stage 2, stage 3, it reduces, you know, it gets lesser and lesser. As you go through stage 2, stage 3 progression, you come to almost, you know, very minimal chances. So that's the importance of the early detection screening program. We aim to present for all types of cancer, from, you know, prostate cancer to lung cancer to many different types, breast cancer, liver. So AI-driven is, you know, now the talk of the town. Everyone talks about artificial intelligence. Today, we have reached as Fujifilm to such an extent that in the healthcare screening center we run, the report is generated by the system itself. The system generates its own report. So basically, in words, you can say, maybe how can you generate a system without no doctor? So the system gives you its interpretation, things, what is it? Is it positive? Is it negative? Or you are in which stage of your disease progression? It gives it, through the AI technology. But definitely still, we need a doctor. Because of regulatory reasons, because of, still the doctor has its skills, we need a doctor, to guide the person to progress, beyond what he needs to do and not. But certainly one day the technology will advance to such an extent that only for healthcare screening, maybe the AI report would be the norm. It would come maybe in future, but as of today, you still need a physician, to guide you through with the help of the AI report. You can see the types of cancer screening we cover. It's complete comprehensive. We cover from, lung cancer to liver to breast cancer to prostate cancer, all major comprehensive types of cancer we cover on that. And also on the lifestyle, cardiac lifestyle diseases, we cover each and every part. We offer packages to a family. Let's say the parents, the father, mother, the grandfather, grandmother, would like to do their screening, as a package. We offer packages so that you cover the complete comprehensive package for the male or the female in that. And it's all done in 120 minutes on that. So you get your complete examination done with the report in 120 minutes, around 2 hours time, roughly. And as you see, this is not like a hospital or ambience. It's created like a 5-star, 7-star spa type, ambience, like you get when you visit Apple showroom. We did this because in these centers, you have normal people, normal citizens going. It's not, patient going in. It's like any one of us who is perfect can go and get their health screening done. So if you look at the ambience, we have created very well, nice ambience, nice hospitality, nice welcome, make them feel very comfortable, get them welcomed by a physician who will welcome them, by an administrator who will make them feel comfortable. So that's what we aim to provide with this screening center. And these machines, what you see, the so-called machines of Fujifilm, of the diagnostic imaging machines, these come with extremely low-dose technology, which are suited to do healthcare screening. So I would like to point this emphasis, because many of us are pretty much concerned on the CT dose or, the machines of mammography dose. But as Fujifilm, we are well aware and we are being approved to do these healthcare screenings with very low dose, because we do this technology on normal, people or normal citizens. And this has been one of our major accomplishments because of the artificial intelligence. So even if we do or things with 500 people, citizens, or you organize batches or camps, for 1,000 people, or you'd go to the remote areas, do the screening style camps. With the help of AI, you can easily detect which are, the positive grade patients, which are the negative. Because for a single doctor to view that, it would be almost next to impossible. So AI brings to the ground, that advantage on that. This is our first pilot project, AI-driven health center, which we created in India, in Bangalore. We did this Fujifilm in collaboration with DKH, Dr. Kutti's Healthcare. They were our clinical service partner, and Fujifilm was the technical services, partner in that. So this was our first AI-driven health screening center we opened, and we aim to present this into Dubai, which is the hub of Middle East, Africa, and many other parts of the world. So Dubai is our next destination and our main destination to bring this AI-driven healthcare screening to the fore. So it's been, as you see, in different parts, hospitality, culture, very nice welcome, low-dose technology with the artificial intelligence driven. So the aim is to create, the awareness of looking after your health And if you do your screening done, you'll be taking care of your family, your children, your parents, because you will be detecting your disease at an early stage. And as you saw, it's pretty much curable. Even today, dreaded disease like cancer, heart attack is pretty much curable. And this is what you can give to your family, a good gift. We have seen many parents from the US or things, their children sends to the parents gift coupons to make their children do these screening programs. So this is one of the benefits we bring with our healthcare screening. Also with the awareness of keeping yourself fit and with the good lifestyle care and good diet, good nutrition, as we heard today. This is what we would like to bring on that. So yes, as Noura Fujifilm Holdings Corporation is very proud to bring this Noura with all our global references on the site. So that's it from my side. Thank you very much. Thank you.
Subin, Uni there, thank you so much, Subin, and thank you for really letting us know the possibilities. And again, it's very exciting that this will come to Dubai, almost a one-stop shop. And I think we all know the importance of screenings, but also sometimes the absolute inconvenience from going from stop to stop. So I find that very exciting. So again, it's great to see the possibilities that are out there and really have a look at what we can expect. And in the afternoon, we will have some other colleagues that will showcase some new innovations and technology to share with you as well. But it has come to that time of day, and it is lunchtime. So we want to invite you to stay with us here, and I'd like you to be back here at 2 o'clock. We only have 45 minutes to give you a bit of a break. Hopefully you'll get to talk to our two speakers. They will be around, see what you want to talk to them about, and then sharp at 2, so 45 minutes, not a second more. Please be back and join us. We have, as I say, many more case studies to share with you, and we are going to have a wonderful panel on precision medicine, something really interesting, and Rachel will be leading that when we come back. So promise me 45 minutes, no more. How about 40 minutes? And then we'll be all back here to get started dead on 2 o'clock. I think that's a good time frame for us, all right? So thank you for being with us this morning, being here at Dubai Chambers Health Week. It's really important that you're with us, and we're absolutely delighted you've taken the time to join us. And as I say, I hope you get time to talk with our speakers and to network and meet some old friends, maybe meet some new, and maybe do a bit of business. Who knows? That's what we like to see, the start of productive meetings. Thank you all so much, and I'll be back to you later on today. Take care.
Ladies and gentlemen, please take your seats. The session will begin in 10 minutes. Ladies and gentlemen, please take your seats. The session will begin in 5 minutes. We would like to remind you that you are to keep your mask on at all times. Our program will start shortly. Please make your way to the plenary. Ladies and gentlemen, please take your seats. The session will begin in 1 minute.
Your Excellencies, ladies and gentlemen, our delegates, and hello once again to those tuning in to our live stream. Good afternoon. Hope you had a lovely, lovely lunch. My name is Rachel MacArthur. You may have seen me earlier on. If not, I'm a medical journalist based here in Dubai. Lovely to see you all. And I'm really excited actually because we're kicking off this afternoon with a very, very interesting topic, one that affects us all, no matter your age, your race, what you do for a living, etc. We're kicking off the forum this afternoon, of course, with precision health. Now, speaking to different professionals, and actually just a quick show of hands, precision health, do you know at least one definition of it? Are there any people who've never heard of precision health? Great, okay, so we've got a mix. So, in my field of work, speaking to different healthcare professionals, I've seen firsthand just how many definitions of precision health there is. So for now, I'm just going to use the CDC's definition of it, which is your genes, behaviors, such as exercise and eating habits, and environment are all factors that affect your health. The goal of precision health is to protect your health by measuring these factors and acting on them, and interventions can be tailored to you rather than using the same approach for everyone. And frankly, given that it's 2022, it baffles me that precision health is not the norm now. So you might have heard of other terms such as precision medicine, precision health, personalized healthcare, value-based healthcare. So we're going to unpack as much as we can within this time. So here to help us are some of healthcare's brightest experts. And joining us, first up is Dr. Peter Pudrick, who's an oncologist and founder and CEO of Ante-Genes. Welcome, Dr. Peter. We also have Dr. Giles Dreyfus, who's a professor of cardiac surgery in Paris and Imperial London. Welcome, Dr. Giles. And last but not least, we have Dr. Istvan Petak, who's a molecular pharmacologist and founder and CEO of OnCompass Medicine. Welcome, Dr. Istvan. So everyone's back from lunch, and we've got a lively crowd, which I love. Welcome, and thank you for being here with us. So I'm going to dive right into it. We were discussing this backstage, that everybody has their own definition of precision health. So Dr. Peter, just very generally, what does precision health mean to you? How would you define it?
I personally think that there are no such separate things like standard medicine and precision medicine. I think that precision medicine is simply next more precise step from current standard medicine. And after some time, then this precision medicine will become new standard medicine. And therefore, for this so-called for precision health or precision medicine, exactly same rules, clinical evidence, clinical value, clinical healthcare regulations, and all such things apply also.
Yeah. Dr. Giles, what's your definition?
Well, I'm interested in different ways in our world, which is the so-called developed countries' interaction between cardiology and cardiac surgery, which is becoming, from two separate specialties, they have merged nearly into one. And this is something which is happening extremely rapidly in our world, and also in humanitarian actions in developing countries where the problems can be quite similar to developed countries. However, they remain for the time being a little bit separated, and perhaps it is a mistake, but they need perhaps some time to catch up.
A little while ahead. Dr. Istvan, precision health to you.
Yes, so I'm a researcher in the field of oncology, and in oncology we have a very concrete, precise definition of precision medicine. In precision medicine, our dream is to find the right targeted therapy for every cancer patient based on the individual molecular profile of their cancer. So the fascinating thing is that now we are able to identify the genetic alterations which cause cancer in each patient. And we can tailor therapies based on this information, and we can use targeted therapies which specifically target these genetic alterations, and this way we can really provide a personalized, individualized therapy.
Yeah. Now, since you actually touched upon that, I'm going to come back to you. Now, it's really interesting if you read the bios of every one of our speakers. It's so impressive that if I just took the time to list them all, the session will be over. So we won't have time for a session. It's insane what you guys have achieved. Now, Dr. Istvan, you head up OnCompass Medicine, and so I just wanted to know, how does going into kind of a deeper dive, what is OnCompass Medicine? OnCompass Medicine, correct?
Yes.
And how does precision health fit into it?
Yes. So with OnCompass, our dream to create tools to guide oncologists to find the right targeted therapy for their patients. And we have to develop technologies. So we founded this company, the Compass for Oncology, in 2003, in the year of Human Genome Project, because that was the first year when we could start the very detailed study of the cancer genome and identify these cancer-causing genes. And first we had to develop molecular diagnostic methods, and then next-generation sequencing-based methods. And now 7 years ago, we started a very interesting project to develop an artificial intelligence-based solution to really choose the right targeted therapy based on the complex molecular profile of patients. So now we have 170 targeted therapies available in the world, and we already know that cancer is caused by around 700 genes, and these genes each harbor thousands of potential mutations, and we also know that each cancer is caused by a combination of this genetic alteration, on average 4 or 5. So, but the good news is the number of genes are countable. So it's a closed box. So humanity reaches milestones. We reached the milestone of the Human Genome Project, and 1 year ago we actually reached the milestone that we can identify the cause of cancer in 95% of patients. Now the next question we try to solve at OnCompass Medicine, how to match these therapies based on the complex individual molecular profile. So our tool is an AI solution which can help the oncologist choose the right targeted therapies based on the individual combination of mutations. And actually we are very happy. We work together with scientists and researchers in Institute Curie Paris. So we just discussed before coming up to stage that it's an international collaboration we do all around the world. And what we want is to deliver this solution to all patients in the world to democratize access to precision oncology.
Love that, democratizing access to healthcare, which rightly should be the case. Dr. Peter, you're also in oncology, so how does precision health shape your work?
We are approaching to the cancer from the other end, or actually before the cancer. As you know, breast, prostate, colorectal cancers are most common and deadly cancers worldwide. But if to detect these cancers as early as possible, it's possible to eliminate their impact or cure them efficiently. And for that, cancer screening programs are applied. But current cancer screening programs only consider age of people as a risk factor. But actually our risks for different common cancers are very different because our genetic predispositions for these cancers are already different. And in our company, Antigenes, we have brought into healthcare use on a clinical grade level new technology called polygenic risk scores. And we have developed CE-marked in vitro device level genetic tests to predict more precisely our genetic predispositions for these common cancers. And these tests are the basis for so-called precision screening programs, which are more precise and can give more efficient recommendations when and how start and perform cancer screening.
Dr. Giles, I'm coming to you next. Now, given your CV, I don't know how you have the time to even be here. You're going around, you do a lot of work in cardiology around the world. What role does precision health currently play in your work?
I think that as soon as a human being intervene, precision becomes questionable. So I think that we are being helped in our specialty like cardiology or cardiac surgery. We're being helped by electronics, by imaging, by a lot of diagnosis tools, communication, assessments. As far as the therapy is concerned, it has been refined a lot, but still it remains on human interpretation. And even if you use tools such as robotic, perhaps people might think that the robot is doing everything. The robot is not doing everything. You need to guide the robot, and you need to know the surgery to use the robot. Yeah. And probably robots are still at their infancy. For instance, you don't have any tactile feedback with the robot, which is something which is missing in order to do refined surgery. What I think is that, for instance, the precision medicine can be seen as a remote diagnosis. And for instance, you look at the third world countries, such as in Africa, where you have an endemic rheumatic fever. A lot of kids in the bush, you don't even know how they're doing. You could, for instance, use a portable echo machine with a technician, not a physician, do an echo to screen all the people, send that to a hub of specialist tertiary care in valvular heart disease, and then you could probably tell the patient that he needs only medical therapy or surveillance or surgery within 6 months or a year, which is not done yet. So there are lots of aspects which, doesn't make this specialty as precise as one would like to or might believe.
Yeah. No, it's a very good point, and the thing is, even just discussing this in a single session, it's just, there's so much to discuss, and there's just so much to find out more about. And obviously, if there's anything you'd like to discuss later on, please feel free to reach out to our lovely speakers. Now, going into the concept of precision health, I'm going to bring it up to more of a general level right now. A lot of factors that have been mentioned need to be supported by data, and lots of it. And I'm guessing it's a core consideration in precision health. Now, improvements in technologies that make collecting data less costly and easier, such as wearables, telemedicine, 5G deployments, can help researchers engage larger numbers of people to gather data. However, it goes without saying that there are a number of legal challenges, legal, ethical, technical challenges regarding to it. One might be the discrimination, for example, depending on the data. So what are the biggest challenges of precision health at the moment? Dr. Istvan, I'll go with you.
Yes, I think regulations are needed not to limit our access to data, but to help us to access data. So I think it's very important that patients should be able to control their data, but research shows that especially cancer patients are happy to share their data if it goes for research. Because this is, humans in general are very good in sharing experience and knowledge. That's why we are here today. This is what we are doing right now. As with digital tools, we can do this. And I think if we can further digitalize medical data, now we will have a global experience which can be united to develop new tools, like to really harness the power of artificial intelligence. Yeah. But this we have been dreaming for decades, but this is now when we actually arriving to this point. And the first step was to really digitalize and parameterize information about patients.
Yeah. Dr. Peter, from a human perspective, just as me as a normal patient, should I be worried that if I were to get assessed and I was told, for example, in 10 years' time, I am at risk or will actually have a form of cancer, should I be worried about that data and who it's going to?
First of all, I think that very important is the quality of data, especially if there are so much data out there somewhere, then we should look what's the quality of this data. Next thing, I think that in case of precision medicine, these solutions should follow all data protection rules we have everywhere and principles. Now, regarding our such personal risk levels, we should understand that anyway, we are all under risk. In Europe, every third man and every fourth woman will get cancer diagnosis during their lifetime. And we can simply specify more exactly who has lower risk and who has higher risk level. And of course, this information should be kept like confidential healthcare information, and same rules as for all other data should apply also to these risk estimations.
Yeah. Dr. Giles, what do you make of the challenges in data, and how can we solve them? Do you have any thoughts as to how we can solve them?
So, I think, if I may, for the audience and for the sake of clarity, we all have in all specialties some guidelines which are derived from publication, results of randomized trials, and sort of accepted good practice, good medical practice. Should we get out of these guidelines or should we not? This is the first question to which we do not have a straight answer. Now, the society wants security. So if you want security, you need to apply the guidelines. Otherwise, you can be sued. But sometimes to treat an individual patient, you need to get out of the guidelines. So this is the first thing. The second thing is publications. Publications require, first of all, tremendous scientific knowledge, and especially in statistics more than ever. So they need to be accurate in terms of statistics. They need to be funded, and the problem is, where do the money come from? Because to do a long trial with thousands of patients, and most of them should be prospectively randomized. So you need to start one there and then finish. And what are the primary endpoints, secondary endpoints, and define what you want to demonstrate. In order to do that, you need to use the same treatment. Everybody needs to use the same treatment, which, for instance, in cardiology is not the case. Every surgeon, every cardiologist has his own tricks and tips. Whereas, for instance, in oncology, they have protocols. And so the best oncologists can use the same treatment as someone who would not be as good. Whereas, as soon as you introduce a human parameter, you create a deviation in the standard results. And so we need this publication. We need prospective randomized trials. We need longitudinal studies. We need serious publication, not rubbish publication. And unfortunately, to maintain academic position, the medical world requires to publish a lot. Yeah. And perhaps there are too many publications. So it doesn't mean we should not publish. Should be able to discriminate those good from those bad publications.
Yeah, of course. Where is the fine line between prevention and panic, Dr. Istvan? For example, it's commonly reported in the healthcare space that one of the major challenges of cancer prevention is to avoid doing more harm than good. So maybe it's more harm to me if I'm told that in 10 years' time I'm going to get cancer. So where is the fine line? How do we balance that? Should we be informing people, or should there be guidelines for when you inform them? So for example, in 5 years only you should be informing them. How does it work?
Yes. So I usually ask the audience whether they want to know if they go out of the left door, there will be a brick falling down on their heads. If they go out on the right door, nothing will happen, it will be safe. Do they want this information or not? Of course, everybody wants to know it, because if we can tell the future, we can tell our risk, we can do something against it, we can change the future. So that's the paradox about genetics, that it's not telling us our future, what kind of cancer we will have, but it helps us to prevent that happening. So it's very important to know. So I think we should use science and technology for our benefit, but wisely, of course. It's a big danger, that the anxiety. So we have to understand what statistics means, also in general, not just scientists, but everybody. But if we know actually the benefits and limits of these technologies, we should then use it. Yeah. So, but I think in many cases the precision medicine is the solution. We need a personalized prevention plan, because mass solutions usually have a very narrow margin of benefit compared to the harm. So if everybody is screened, we save some lives, but we also introduce unnecessary anxiety. But if you can personalize also the screening, then that's the optimal solution for all of us.
Yeah. Another area to consider, well, who is paying for all of this? You know, Dr. Giles, you mentioned that transforming initial successes to a larger scale is going to require a coordinated and more sustained national, international effort. So who should be, very quickly, I'm going to ask each and every one of you, who should we be engaging from now? Is it just governments, private sector? Who should we be engaging? Or it could be everyone. Just who are your thoughts? So Dr. Peter, who should we be engaging from now to adopt precision health in the future?
I think that actually it's very complex, because governments, they are not directly doing innovations. And of course, such academic research institutions should be involved, universities and so on. But actually such innovation goes into real life in using companies who bring new products to the market and new services. From same time, if we speak about public health care, of course, governments should regulate all health care. For example, these data protection questions, also problems with possible discrimination should be regulated and not allowed. And of course, in case of public health care, cost efficiency analysis of various applications should be also performed, and these new practices should be applied, especially in public health care, according to clinical utility evidence and cost efficiency analysis.
Yeah. Doctors, I think Dr. Peter actually covered them all. So are we missing any?
I think, of course, you should inform the patient, and we should attend meeting and listen to what is done around the world. Now, what we have to understand is that the current environment is getting every day more complex. You have the patient at the center, and then around the patient you have the pressure of internet and the media, where the patient gets informed. You have the publications, you have the insurance, you have the manufacturers, and you have the cardiologists and the surgeons who try to find what is, during what is called the heart team, the best option for a given patient. Now, what happens sometimes is that either the industry pushes very much to get their product used because they have some financial feedback, which is, of course, understandable, otherwise there would be no progress. And you also have the patient information who comes and says, I want this and I don't want anything else. Yeah. So in the middle of all that, we need to try to do our best to make the patient understand that we will try to do the best for him, which is not perhaps always what he thinks is the best for him. Yeah. It's very difficult. Information is good, but too much information or misinformation is bad. Yeah. It is a very difficult problem you're raising.
It's a fine line. It's a fine line. Now, we're obviously we're just exploring very surface level today, and given the time that we have, because we don't want to go over for the rest of the afternoon as well. So just very quickly, as we come to an end, I just wanted to know, just your very, very quick predictions. What will it take to bring the vision of precision health to free? Like, when do you see precision health becoming the norm? Is it a decade, 20 years, 30 years? Dr. Peter?
I think it's always the norm. It's always in medicine we are looking to be more precise. This was in the past, in the present, and this will be in the future also. It's such norm always to be more precise.
Yeah. Dr. Giles? Deep in thought.
I think the seek for precision is, of course, something we need to have in the back of our mind. I'm just a bit dubious about the fact that we can be as precise as the environmental technology around us. Computers, MRI scans, CT scans, echo, biochemistry, physics are precise. Will medicine be precise? Even with, we don't have time, but even for very simple things like you have 3 coronary arteries, and to decide whether the best treatment is medical treatment or stents or surgery is still under debate after 20 years, despite all the knowledge we have on this. It looks very simple. It's so complicated because there are so many parameters. Perhaps artificial intelligence will tell us. But it's a seek of precision rather than precision.
Yeah. And finally, Dr. Istvan, how many years?
So I can give you numbers to calculate. I mean, I already
the average,
mentioned
yeah.
700 genes. We have 170 drugs already developed, 90% of them developed in the last decade, so we can expect another 170 in this decade. And because of the long tail distribution of genetic alterations, with the 300 drugs, we can cover more than half, or 70% of cancer cases. Actually, today, 50% of lung cancer patients are treated with targeted therapies or immunotherapies based on protocols in registered indications. So I think by the end of the next decade, the majority of cancer patients will be treated based on precision oncology.
Fabulous. As I said, we were just here to scratch the surface, and I highly encourage you, if you don't mind me saying, to connect with our experts online, because truly the conversations and the insights you have are astonishing, and they're so interesting. Just before we go, I'd just like to thank you for being here. Dr. Peter Pudrick, oncologist and founder and CEO of Antigenes. We've got Dr. Giles Dreyfus, professor of cardiac surgery in both Paris and Imperial London, very busy, and you do humanitarian work as well. And finally, Dr. Istvan Pitak, molecular pharmacologist, founder and CEO of OnCompass Medicine. Thank you so much for being here with us, and please connect with everyone before you go. So please join me in thanking them. Great. So on to the next session. We're just going to have a short video playing to prep you for that, and we'll see you shortly. Thank you, guys. Let's
go. The new normal, where amidst the chaos is a stillness for much-needed introspection, where in the break from excess is the discovery of the essential, where despite social distance, deeper bonds are forged, and there is new belief in the power of collaboration, where much appears to have changed, yet much remains the same, where a global consciousness has awoken to recognize and appreciate today, where health and wellness are priceless and empowerment champions diversity. We have awakened to a new today, where optimism for the future is our new reality. And as we take a step forward, it's time to join us and make your mark. Welcome to the city of broadened horizons. Welcome to Dubai.
And a big thank you to Rachel and her panel. They're talking about precision medicine. And if we thought health and medicine was complicated, we've even seen a whole new realm of complication, I think, in that, but fascinating in terms of what can be done. And indeed, again, I think it comes back down to prevention in terms of us all looking after ourselves too, and what we can look into the future and how we can actually deal with what is expected, what's to come, and again, comes back to prevention, I think, time and time again. Now, in this session, we've decided to call it Ideas Pad. And really, this is a platform for innovative ideas. We've identified a series of young, dynamic, creative players who are out there in this space, really looking at new technology and looking at what can be done, what is being done, and indeed what we can expect for the future. So we're really going to highlight technology, and this time all the way from Hungary. For many of you who've been in that Central European country, it is a thriving metropolis, so to speak. It's steeped in history with a big eye to the future, and so much going on there. So really, really lots of dynamism, lots of excitement, and lots of tremendous young talent coming out of Hungary and really looking at what's going on. So I'm very, very excited to be able to present all of our speakers to you. So they will just do a presentation, and then hopefully, if there's time afterwards, you might be able to meet some of them and talk to them about some of their ideas. But we won't have a Q&A. We won't have the opportunity for that. But we do have, and I'm really honored to make sure that we have the time for at least for them to present and to be with you and let you know what they're working on, what they're doing. So it's very exciting. So we'll give them about 10 minutes each, and we have 5 speakers. So really, really interesting work that's going on. So I think it will inspire all of us. So let's get started. We have with us from Omron Medistance, the digital health strategist, and he's going to look at Medistance, really this end-to-end solution. I think I'm better off just giving you the name and telling you where it's from, and them letting them inform and inspire us. So a very warm welcome for Fruzina Metzi. Fruzina, I think, is with us. Here she is. Great.
Welcome, ladies and gentlemen. My name is Fruzina Mezei. I am a health economist and a digital health lead of Medistance. Today, I'm going to give you an introduction into why utilizing health status data is important and what big pharma, clinical research organizations, and healthcare providers can gain from implementing a health data management solution. About 80% of all healthcare data that's generated during care is inaccessible for further decision-making. Medical professionals often don't have access to the necessary insights to make accurate diagnostics or decide on the most effective treatment. As a result, patients aren't always getting the treatment they need, and they are forced to come back to the doctor to reevaluate their condition or their treatment plan. This does not only lead to 112 billion excess costs for the healthcare payers on a global scale, but to 60 million premature deaths due to inadequate treatment each year. This is the issue we are trying to solve with Medistance. Medistance is a solution that collects, manages, and analyzes health status data directly from clinically proven medical devices. With Medistance, healthcare professionals can better understand disease progression by accessing about 12 times more data points compared to current standard care protocols. Health professionals can also support therapy optimization with real-world evidence and lower the cost of treating each and every chronic disease patient in their clinics. The system works with clinically validated medical devices from well-known brands such as Omron and Medicana, These devices are actually all certified in EU and the US country as well. These measurements are, or these devices collect measurements through a data transfer hub that delivers this data into a GDPR-compatible database. In this database, users can analyze the data by preset algorithms and models in geographical, spatial, temporal, and cost dimensions in order to help therapy decisions. Our main customers are clinical research organizations, big pharma companies, and healthcare providers. For clinical research organizations, we provide direct data capture and remote monitoring to decentralize clinical trials. This has proven especially useful in the times of the pandemic, as it's really resource intensive to set up a clinical trial on site in a hospital with all the lockdowns that are globally going on. For pharmaceutical companies, we provide anonymized real-world evidence on efficiency of their therapeutic agents. For healthcare providers, we provide an end-to-end remote monitoring infrastructure and real-world data for treatment optimization. In addition to the non-monetary value, which is obviously health gain and an improved quality of life for patients, CROs can lower their operational costs by about 25% by eliminating on-site trial costs. Pharmaceutical companies that we've been working with have increased their box sales by about 18% only by supporting their sales and marketing activities with real-world evidence on their existing drug agents. While healthcare providers can reduce their costs related to care by about 31% within 3 years of implementing Medistan's solution by avoiding chronic care complications and unnecessary patient visits. We already have several long-term clients in Hungary, and we also have some projects in the pipeline for the coming years. Our current goal is to set foot in the Middle Eastern and African region, particularly in the Middle Eastern and African countries, with a focus on the United Arab Emirates and Saudi Arabia, Turkey, Egypt, etc., India. Compared to similar solutions on the market, we customize the infrastructure to the disease group that aligns with the customer's exact needs, goals, and profile. We have super fast data processors. We conduct digital data capture with real-time analytics and the real-time reporting. And we can expand the infrastructure to up to data collection from about 10,000 devices simultaneously. We also provide the opportunity for our clients to communicate with the patients through the Medistan's platform. This is great for healthcare providers, but also pharmaceutical companies if they want to give some therapy-specific data or information to the patients, and also for CROs to remotely manage their trials. There is opportunity to have patients fill out patient-reported outcome forms or surveys regarding to treatment, symptoms, adverse events, or etc., whatever is needed really from the patient. Okay, so approximately 75% of our income is coming from pharmaceutical companies from this sector. So this is why we'd like to prioritize expanding into this sector. So with these priorities set straight, we are expected to achieve about 2 million euros revenue by 2025. We are currently looking for an investment of 3 million euros, which will be spent on expansion to the Middle Eastern countries and African countries as well, with a focus on the United Arab Emirates, Saudi Arabia, India, etc., as well as on product development, personal costs, and marketing. But what's more important is we are looking for partnerships with distributors and research organizations, research entities like universities or research companies for real-world data research projects. We have a competent team behind our solution, combining about 100 years of experience in fields of medical device sales, field medicine, digital health, and data analytics as well. We also have global partners standing behind us. With their support, we can provide an even more robust and secure service when we are expanding abroad. So I invite you to partner up with us and create more optimized therapies to reduce the 60 million premature deaths to zero on a global scale. We'll be here in the afternoon, so please feel free to find me to explore potential synergies. And we'll be also here at tonight's event. Thank you very much for listening.
Thank you so much, Frugina. And again, some great work going on there. And it really is, it's about data collection, but also about what one does with that data. And I think there from Medistance, we got a great impression of what is happening and what could happen. So if you've got a spare 3 million, I guess Frugina is your girl, but she might have a little bit of competition coming up now because we are going to hear from a few more great presenters. And again, when we look at diagnostic applications, they're not all necessarily creative equally. So let's hear from Mirova, and psychologist and educator is joining us now, Rika Rozsos. My Hungarian is probably not anywhere near as good as it should be. I can just about say a few words, but Rozsos. Okay, we'll get it right. Good luck. Lovely. We're going to look forward to hearing from you, Rika.
Okay, so in the past couple of years, humankind had to readjust and relearn so much. Please put your hand up if you had to teach your child how to study from the living room, or smile or wink at your neighbor if you also had to bring your office to your living room. Or put your hand up if you had to schedule a family event online. We also had to learn how to take care of our own health from our home without hospitals or without the healthcare professionals that we are so used to having. So platforms that can accommodate these needs are growing and ever so popular. But our story does not start here. It starts in 2018, where I was sitting in a coffee with my father, who told me that he's been working for the past 30 years with patients affected by diabetes with a group of doctors, and they have developed a very successful method with thousands of successful treatment stories. And he's ready to start writing another book about his newest findings, but he doesn't want to write a book anymore because books just cannot follow how fast the medical field is evolving. So the idea of an application that can be updated was born. It was not born because of the pressing need COVID showed us, although our platform did come in handy. It was born because there are some staggering numbers. For example, 422 million. This is the amount of people who live with diabetes worldwide. This is the number 9 leading cause for death worldwide, but we don't know much about it commonly because this is a slow and silent disease. But among the outcomes that diabetes can cause, there is heart failure, kidney problems, blindness, or our main focus, which is the loss of a lower limb. So based on this 20 plus, nearly 30 years of experience, we have developed an application for doctors and for patients that can store all this knowledge and that can help these participants to build partnership. This platform can help the patient to understand what they are going through. It can help the doctor to communicate with the patient. And it is honestly a lot more than just searching for your symptoms online, because it is personalized for you. There are hundreds of different treatment plans that you will find that you can read that is reliable, developed, and written by doctors. Well, doctors will care about your physical health, but I'm a psychologist, so I have to care about mental health. And I guess we can all agree that if there is a lot of worry, anxiety before you receive your diagnosis, or after you receive it, there is a lot of anxiety when you have to face the uncertainty of the future. This can cause and this can take a toll on your mental well-being, not just yours, but everybody else around you. But I have good news. In the 21st century, we operate with a new term, the expert patient. The expert patient is a person who takes a little bit of the responsibility back from the doctor, who's also part of the treatment process, who also needs to understand what is going on with them. For this, we need to educate them. We need to give them the tools so that they can take a little bit of control back. They can work in partnership with their doctors. Think about it this way. If you get lost on the road, and you cannot find your way, you take your phone and you consult a navigational system. Our platform, our application, is a navigational system for the path to a healthier future, because it is in your pocket. You can consult it even if you cannot see your doctor at that time, let it be pandemic reasons or other life situation. You can consult it and store all your important information that you ever need, or it can also broaden your horizon when it comes to thinking about your diet, the movement, or the application will actually tell you what kind of socks you should wear. So it is very important not to get lost on this road when you're trying to take the control back, because research shows now that if the patient holds the knowledge, it is an unused resource that has huge potential. So what we are trying to do is give this knowledge, give this tool to the doctors and the patients so they can work together in partnership, not without each other. Patient can take a little bit of the control back and understand what is going on with them. This application right now is a Hungarian application for Hungarian users, because we are from Hungary. We have 5,500 active users, 8,000 downloads, but we do believe that there are millions worldwide who could use the information like this. So this is our goal, to develop an English global app that can be altered for the different countries, working with local professionals in each country. So what we would want to do is to make this platform friendly, nicer, maybe even enjoyable. It would be difficult to tell you how this looks like, so let me show you some images. All right, so in case you're interested, or if you hear this call for action, or if you believe that maybe you can use some more information about this, find us in the Hungarian Pavilion tomorrow at around 2 o'clock, and, let's talk about the future. Thank you so much.
Thank you so much, once again, Köszönöm. How exciting is that, to an app that's going to help us, a navigation system, again, helping us to live a healthier life. And I love that concept of being the expert patient. I think sometimes we all think we're the expert patient because we depend on Dr. Google probably a little bit too much, but actually it's about more taking a proactive role and being involved. But again, really, really interesting concept there, and I think it does look like something that we need to get into many languages. I'm sure it's doing a great job. As you said, you have lots of users in Hungarian, but we really need to be seeing something like that. So it'll be good to go visit. It's lovely to visit the Hungarian Pavilion anyway, but tomorrow when we have all of our great innovators there, indeed, it's another great excuse to go. We're now going to look at a company called Now Technologies. So a big warm welcome for the lead product manager, Livia Nagy. So Livia, join us now. Thank you so much.
Thank you. Good afternoon, ladies and gentlemen. My name is Livia, and I represent Now Technologies. And I'm here to talk to you about innovation in assistive technology. Now Technologies aims to provide 21st century solutions to a group of users that really need it, powered wheelchair users. We would like to reform and change an industry that is highly, highly conservative. And we would like to do that while we are helping the families, the users, and the system. Intelligent personal mobility is our focus. We are putting out products that can afford people with never-before-seen independence. We would like to allow everyone in a powered wheelchair to live their life to the fullest potential. We would like them to work, create, and communicate to the best of their ability. I would like to talk to you about two products and a little bit of the future. The first product is the Vigo. That is a proportional head control that requires only tiny head movements to be able to drive a wheelchair. People with high-level injuries, ALS, multiple sclerosis, cerebral palsy can all benefit from the Vigo. We have sold over 200 units across 20 countries and 4 continents so far. The Vigo is not only proportional, but it is safe, secure, and you can also use it as a computer mouse, meaning that you drive around, live your life in your house, and then when it's time to work, all you have to do is go to your computer, and with a hit of a button, you change to controlling your computer. Let me show you a video. So there are about 12 million people who use specialty input devices such as the Vigo. But there is an even bigger user population, all powered wheelchair users. In 2016, Now Technologies created a whole new guiding system for a wheelchair that allowed for much more up-to-date solutions than what are currently available in the world. These are two of our beta users, Miklós and Zsuzsa. Both of them have been using the Vigo for 4 years, proving its durability and its potential. So right now we are working on commercializing the gyrostat guide, and we would like to show you what we believe the future of wheelchairs can look like. Wheelchairs as personal robots. There has been tremendous advancements in autonomous robot technologies, and we believe that it could be and should be put to great use within the assistive technology industry. We expect wheelchairs to be safe. We expect them to supersede human-level reaction times. We want them to help each and every user to their customized needs. And so we have applied certain technologies such as robotic vision, collision avoidance, voice control, all readily available in the mobile robot industry, and we are now applying it to wheelchairs.
Turn left. Go straight.
So, if you also believe that there is a user population that can greatly benefit from these solutions, I would like to ask you to come, let's chat about it, or get in touch. And I thank you for your attention.
Livia, thank you so much. And indeed, I think we can all see very clearly there the great advantages of actually adding that robotic expertise that they bring from Now Technologies and applying it. For anybody who knows anybody who has been confined to a wheelchair, you can really see the tremendous advantages on that. So much has been done, but I think they're on the right path there to actually do so much more, which indeed all people who have mobility impairment issues would welcome so much, because I think fabulous ideas, as only we expected from this great team. We're now going to talk to the CEO and co-founder of Heartbeat Holdings. So I'm going to welcome George Cosman. So warm welcome for George. George, thank you for being with us.
Hello, ladies and gentlemen, and thank you for attending this session. I'm George Cosman, the founder of Heartbeat, and today we are going to look a little bit into cardiac problems, which are between us. About 55 million people die in the world in a year of some kind of ischemic-related issues. This can be heart attack, this can be some kind of stroke, or some kind of other ischemic problems. Heartbeat thinks that this number can be reduced. If the world would have a product which could be easily used, easy to wear, and eventually an end user could get the information, what are the limits that they can from cardiac point of view, not overgo, this would be helpful. So at the end of the day, this is why we developed our product, Heartbeat, which is an easy-to-wear t-shirt, which has 3 leads of ECG signal and a head unit, which can be easily popped on. This is very important because with this construction, people can use it during their physical activity as an Under Armour, for example, and also it can be used for those who have already gone through some kind of medical issues or cardiac-related issues, and they are in the rehabilitation phase. So we are hoping that this will really revolutionize the market we are looking at. So once again, our product goes mainly to already people who are using some kind of fitness watch or smartwatch, but they would like to have a deeper understanding of what's happening in their heart health. And with the 3-lead ECG system, they can have a 3D overview of their heart muscle status. This is very important because in this way we can see the electrical connectivity besides the cells, and this can give us very important information with a waveform analysis system which is integrated into the heartbeat head unit of does this person or does this user have extended risk for stroke or sudden cardiac death. These are all symptoms which currently people think are untouchable and people go to checkouts very rarely. That is a big problem. So for an ECG checkout, people usually go 4 to 5 years, depending on which part of the world we're talking about. And this is why these symptoms stay hidden. With heartbeat, they are unhidden. And with that, with simple transferring these people who have these extended risk and just they pop out during their daily run or physical workout, we can send these digitalized data to their doctors. And with the help of this, they can get medication or the proper, let's say, protocol can be done to save these lives. So how does it work? Heartbeat eventually stands from 4 major points. As you could see, the first is the T-shirt itself, which is, can be used for men and also women. And also the head unit, which has a little processor inside, and also the inbuilt algorithm, which has over 50 years of experience in it from our engineering team of cardiac risk analysis. And it gives a real-time feedback to the user until what is the point when they are overloading their heart muscle, and eventually they should slow down a bit, or best case scenario, push a little bit harder to reach their cardiac and physical goals. The other one is the application, where people can, it's eventually our interface where we communicate with our users, where they can get direct feedback of their current physical status. And once again, I cannot say it how important it is that it's real time. So it's not like when you are having a Holter monitor on you, you have to go back, evaluate it at the hospital, and then get the result. Eventually, this is the case in Hungary. Maybe it's different in other parts of the world. A long time afterwards, that arrhythmia or other ischemic defaults already happen. So, and after that, from our backend system, where these data, digitalized data, gets uploaded, the user can share it with the medical professional or with the personal trainer he's training with, because we believe, and my other slide would be is a little bit about our current situation, this COVID situation, where we figured out that there are, of course, and this is well known, post-COVID syndromes which affect the heart muscle itself. And with the help of Heartbeat, and that's why we are cooperating with the Hungarian Olympic team, we helped some athletes get back in a healthy cardiac lifestyle and to be able to go to the Olympics, because they did their physical workout and trainings with the help of our system. And because of that, they didn't need to stop their training sessions. They were under control and finally succeeded to go to the Olympics. So this is why it can also be very important in today's world. What's our vision? Our vision is that we believe that there is a transformation on the market, and we believe that as back in the old days when the PC arrived, we are living the similar phase with the wearable technologies, and we would like to be part of that. So we would like to be part of this revolution and want to have a big segment in the wearable technology market with all the medical and non-medical wearable technologies around cardiac risk assessments and evaluations. And eventually, at the end of the day, we would like to become one of the first and leading smart wearable, smart clothing companies specialized on the cardiac market. So if I could have my video, please.
Welcome to the world of Heartbit, where every beat counts. Let's get started. You receive the following with your Heartbit starter pack.
It's good without noise as well.
Heartbit multi-sensor top, Heartbit device.
So eventually this is how it comes in a pack, and we are launching our product in the UK from March, and we would like to go forward all around the world, of course also in the Arabic region and the US region as well. And why we are here is we are looking for partners who see the same vision as we do, and we are happy to cooperate. We are up and running. And our goals are pretty high, but we hope we can achieve that. So thank you very much for your listening and for coming here.
And George, thank you so much. I was wondering why he was sort of holding on to his T-shirt back there. I didn't know if it was a comfort blanket or something. Pardon? We'll get contacts for everybody, and we'll make sure that they're there afterwards for sure. But again, and I think perhaps if we look at Heartbit, George, we can find it online too. But again, and I think here in Dubai too, you know, you've a tremendous amount of people here who would be interested, and there's great running clubs and all of that. Probably I should join one of them myself and check out the Heartbit. It wouldn't do me any harm. But to have that constant monitoring, I think, again, something that people would find it very, very useful, and particularly when it comes to prevention more than anything else. I'm absolutely delighted now to welcome the Customer Care Director from Femtonics. He's with us, but he's joining us virtually. Dr. Zsolt Ivan is with us. I see him, he's online. So give us a little wave there. He's going to join us. And now he will also talk to us from this Hungarian biotechnology company. Dr. Zsolt, I'm handing it over to you.
Thank you so much. Thank you so much. Can you hear me? Can you see me very well?
You're loud and clear. Lovely to see you. Thank you.
Thanks so much. Thanks so much. Ladies and gentlemen, welcome to everybody. It's super nice to be here. Unfortunately, I couldn't travel to Dubai, unfortunately, but I'm super happy to join this great conference. In the next slides, I would like to introduce ourselves a bit. Femtonics. Oh, I'm sorry. I don't know why is it just moving so fast? Can somebody just help me? Okay, now we are okay. So Femtonics has been established in 2005, so we're over decades, and is still 100% Hungarian property company, and we are super proud of that we are collaborating and working together with the biggest names of universities across Europe and the whole world, from the North American region through the Arabic region and to the APAC region as well. And we are always believing in the innovative products, and we always try to put something new on the table. And that's why we have more than 40 patents and lots of research groups collaborations all over the world. We are also super honored to awarded from time to time through the years. And we are super happy that we earned the Basic Research to Market Innovation Award in the last 2 years as well. But what I am talking about during the upcoming slides, after this quick introduction, how we prepared ourselves for the near future and how we changed our life according to the impact of the COVID-19. We recognized and realized that the world is really hungry to have safety in our world, in our daily life. And that's why we started to invent and started to commercialize a brand new revolutionary SARS-CoV-2 test which is able to everybody on the market. It is called Femto ID Lamp Kit, and it's completely different from the already available genetic test. So yes, it's a genetic test. It's similar to the PCR test, but there are several huge differences. It's easy to use in existing qPCR lab instruments, so there is no need to add or invest any other expensive instruments. And it also works in isothermal reaction, which means it's super easy to handle it. And why is this important? Because according to the latest news of the scientific research, right now there are over than 2.5 million virus mutants all over the world. And thanks to this Femto ID Lamp Kit, we try to minimize the false negative and false positive results as well, validated by true clinical researchers as well. So the specificity and the sensitivity is the same all over the PCR ones, and it shows up and shows the active infection, and that's a crucial difference according to the researchers. So that means that even though there is several fragments of the virus in our organs, but it's not infectious. The PCR also shows that as an infectious. So it's such like a false positive, but it also blocks our life. The Femto ID Lamp Kit detects this one as well, and it always says a positiveness or negativeness if it's really positiveness or negativeness. So the active infectious showing it's one of the true point. The other two advantage is this is one of the fastest and most accurate testing method thanks to this LAMP method. Because usually the PCR testing methods last between 1 or 2 hours, but we could provide, thanks to this new method, the LAMP method, it provides an average results in 4-10 minutes. So whenever the world is super fast-paced, time is expensive for everybody, and we could provide real infection validity, for example, in 4-10 minutes. The packaging of this box is 100 tests per each box, and we could easily adjust our manufacturing for flexible manufacturing requests. And not to mention that it has a really attractive price, and so it's an advantageous cost and benefit ratio with a CE mark and ISO 13485 certificates, and we are ready to distribute it worldwide. We are super happy about the testimonials because it shows us we are on the right pathway. Thanks to that, it covers all new emerging virus strains, and it's not just super sensitive and budget friendly for the governments, for the companies as well, but it's ultra fast, and it provides never seen significant benefits. Also, we are super honored that not only us who just detected this RT lamp technique, all over the world there are several laboratories who detected this RT lamp technique in laboratory diagnostics and in laboratory environment. And there are several, there are many comparison results between the RT lamp and the RT qPCR. And those results shows us that we are on the right way because it has the same diagnostic accuracy all over the world. Also, it's crucially important in our daily life how we could adapt ourselves to the new virus strains, how we could adjust ourselves to the new discoveries and challenges. And we are super happy that we designed and we planned and designed the whole product according to the to that part of the virus which couldn't be mutated so fast, or couldn't be mutated anyway. And that's why, for example, if the Omicron or any other new virus strains could show up, we could detect it from the ground immediately. So why we are here? We are super happy to participate at this conference, and we are looking forward great business and esteemed business partners to spread our messages and able to distribute this product. And not just this product, but all of the other upcoming products as well, because Femtonics is working at the neurobiology, neuroscience field for decades. And we just recently established our MedTech division in 2020. And this is our first product, and several others could come over again and again. And we are looking forward as STEM business partners who already sees our visions. So that was it, and thanks so much. I hope it would be a successful conference for all of you. And I would encourage you that if any questions could come up or pop up in your mind, just please contact me directly or through Barbara Turk or the Hungarian continent. And again, thanks so much. It was an honor to speak to you.
And Dr. Zsolt, thank you so much. That was Dr. Zsolt Ivan there talking about that PCR test, genetic test for rapid detection there. And again, I think all of these great ideas, looking for partners, looking for people who are interested in helping them. So they're using the bioinformatics system, you know, the capabilities of what the great work they've done here, and I think how they've really used the science and how they've actually built in the technology, the engineering, the creativity there. So it was great to hear from Dr. Zoltz there from Femtonics, bringing us up to date on the capabilities there. Also, of course, we heard from George from Heartbit, that heart analysis activewear, again, another very, very interesting product. Livia brought us up to date in terms of robotics for wheelchairs and really, you know, adding an extra layer and more freedom and mobility to people who have been compromised in terms of their mobility. Reka is looking for us to become that expert patient in that health navigation system, and then Frugina also helping us to understand with the data, helping us to understand our own health better. And all of this, you know, basically I think being of tremendous help to all of us in terms of what we can do in terms of prevention and looking for a better life out there, basically. But the technology, I think, that we're seeing and hearing from these young inventors, these innovators, these leaders of companies, I mean, it's just, it's really, it's staggering in many ways to just see what's going on. And this is just a little part of what we were able to bring you, but we felt it was very important to give you a look and a feel at some of the great innovators that are out there, and perhaps there may be business opportunities for many of you, because at Dubai Chambers, this is what it's all about, matching people with business ideas and making sure that, you know, your ideas and or their ideas and your money, or your ideas and someone else's money, who knows, you put it all together and there's tremendous opportunities for success. So it's really lovely to see the great work that's going on. So this really brings us to the close of the day. And, you know, as I've said, I think it's been a very busy, engaging, informative, hopefully an educational and hopefully somewhat inspiring day for you all. It's always lovely to have everybody here, and particularly at this Health and Wellness Forum. There's so much, I think, in terms of what we all need to look for, and everything we talked about today touches everybody's lives somewhere along the line. I think it's the one key thing we've all realized. Our health is our wealth, and that, I think, has been brought home so much in the last couple of years. So I think it was very, very important for Dubai Chambers to really examine this in depth. We've heard all about earlier this morning about the tremendous partnerships that are out there, the fact that nobody can go this journey on their own, and we all need partnerships, yes, internally here with the different departments, with the private and public sectors, but we need partnerships around the world. And also, I think that no point reinventing the wheel for any new country or any new company. There's a lot that's going on whereby we can all learn, and more importantly, I think we can all benefit. I think this is absolutely essential from all of the great work that's going on. So that, I think, came across very clear. We had time to examine, of course, the success here in Dubai and the great work that the department, the Ministry of Health, there I say it again too, I'll be called up on that one, but the Ministry of Health and Prevention has done in terms of making sure that Expo was delivered to, yes, all of us here in Dubai, but to people beyond Dubai. And I think over the various sessions, we've seen so many people coming from so many different countries, and Dubai Chambers has been able to bring that to you as well. So it's been really exciting in terms of the people that we can get involved with and just see what great creativity is going on. We also, of course, discussed with many key players out there, how the pandemic is changing our lives, what we might do in terms of how we'll work different, how we live different, and again, really looking at innovative ideas, looking at technology, looking how it's driving what we do, looking at precision medicine, how exciting that is, and how everything can be individualized. There's so much that is going on, and all for the benefit of us living a better and longer life. And then when we have time, we can all go off on our medical vacations around the world and look at the great hubs for medical tourism. So all of that was covered today, and I think by great experts, by great leaders, government officials, and just leaders in the great field here of health and well-being. So I want to thank all of you for coming. I want to thank, of course, all of our contributors, all of our speakers, our moderators who came with us here throughout the day. But more importantly, I hope this added value to all of you, and I hope you take away from it something to think about, maybe some new relationships you put in place, maybe some ideas that you can get also involved with. And again, we're going to hear from our Hungarian colleagues tomorrow. They were saying they'll be at the Hungarian pavilion, but they will be around shortly after this. So once again, it's been another great day here, brought to you by Dubai Chambers. Keep an eye on the website, have a look at what they're doing. They're always ahead of the game. You know, liaising with people from around the world, bringing you business opportunities here in Dubai. And we're also so grateful for them all to keep us in touch with what's going on. So for myself, from all of the organization, the organizing team behind the scenes, very, very busy, from all of our technical people, our translation staff, everybody that's out there, and to all of the people online, of course, who've been watching this, I want to just thank you all and bid you a lovely evening. And hopefully we'll see you again soon. Thanks a million.